So are they starting the live stream now, or
I'll go ask.
why don't you have them start? Yeah.
What was that?
Yeah, just go have them
Yeah,
start.
I'll see how it pans out.
That's gonna be
Because we're going to have to do the sequel.
Exactly.
Part 2.
Welcome, everyone. We're going to get started in just 1 minute. We're just getting the live stream going, and then we'll begin. Okay. So welcome, everyone. My name is Adam Levine. I am Director of the Center for Human Rights and Humanitarian Studies here at the Watson Institute for International and Public Affairs. And on behalf of the Watson Institute, as well as the Civilian Military Humanitarian Response Program at the U.S. Naval War College, we are really delighted to invite you here for our annual research symposium and workshop on civil-military humanitarian coordination. This is an exciting time because it's the first time in 3 years that we've been able to have this workshop in person. The last 2 years, I know many of you joined virtually, which was the best we could do, but obviously not the same as being able to be here with colleagues from around the world, from different agencies in person, and having the opportunity to network as well as hear presentations and so forth. So we are really excited to have you all here today. We're going to start today with the research symposium, as you can see from your programs, and just a little note on logistics and some of the differences. So the research symposium today is live streamed, so people around the world will be watching it, which means that nothing said here today is going to be confidential, but hopefully that won't stop folks from asking really great questions, as I'll get to in a little bit. Tomorrow we will start the workshop portion, which will go through the end of the day on Wednesday, and the workshop will not be live streamed. It will be a closed event, invitation only. And as we'll talk about tomorrow, we'll be using Chatham House rules, so everything in the workshop will be non-attributable to individuals. So those comments and discussion points that are a little bit more sensitive can be brought up tomorrow and Wednesday at the workshop. But just so you know, today the event will be live streamed, including all the questions afterwards. So on behalf of the center, we are thrilled to have launched our new program on civilian military humanitarian coordination just last year, and to have joining us Alexandria Nyland, who many of you have met and interacted with as our program coordinator. And so much of this event we have her to thank for in terms of the organization and planning behind it. And so hopefully things will go smoothly. We are a little rusty when it comes to running events, but we're looking forward to this chance to get things going again. Many of the projects that you hear presented today are research streams coming out of our program on civilian military humanitarian coordination at CHRHS here. And then several others were funded by seed grants that we've been able to give other researchers to do specific projects related to civilian military humanitarian coordination. And that's actually something we'll talk a little bit more about. We'll have the opportunity to fund more seed grants this coming year. So as you think about the research being presented today, as you discuss with each other your specific topic areas tomorrow in your working groups, something to consider is whether you might have your own research that you want to do and perhaps present next year at this research symposium. And so there are definitely opportunities to be able to do that, and also some funding, which we'll talk later about in your working groups, that we can make available for seed grants to do new research projects in this arena. And really the whole goal here is to be able to develop an evidence base, to have some data so that we can fill in our discussions tomorrow during the working groups with actual real evidence, in addition to people's experiences and perspectives from each of your different areas and organizations. So as we go through the research symposium today, I will be introducing each speaker in turn. I will only be doing a very short, brief introduction to each speaker, but I highly recommend that you guys look in your programs and read their full bios. All of our speakers here today are really amazing and have done a lot of incredible work. So I may not be doing them justice during my presentations, but you have their full bio in your program, so please do read that. After each presentation, we will have an opportunity for Q&A. And really, we've left almost as much time for Q&A as for the presentation itself, because we think all of your opinions from your diverse perspectives coming from military, civilian government, humanitarian NGO, UN agency, and academia backgrounds are really important. And we want to give you the chance to engage with the researchers, to ask them questions about their research, and to really push in terms of the next steps and the applicability of this work in real-world contexts. So the way we'll organize that is after the presentation, so we'll ask you to hold questions till the end, and then after the presentation, Alexandria will be walking around with that microphone there, and so you can just raise your hand and I'll call on you and we'll get you the microphone, and then you can ask your question of the presenter. We may, if we do start to run out of time, we may start to take a few questions at once, but hopefully everyone will have a chance to get their question asked and answered. But really do be thinking about questions, because that's going to be a really important part of the symposium today, to have that interaction with you guys here. Unfortunately, for those of you watching online, we don't have a way for you to ask questions, though there is a chat function within the YouTube link, and so you are free to use that to make comments and questions as well, and maybe we can see if our researchers can get back to you afterwards. But for the questions today, they'll come from those of you here in the audience live. Just in terms of logistics, we're going to have the first presentation, which is a bit of a longer one, because we have actually 4 researchers plus myself who will be presenting it. And then afterwards, we're going to break for lunch. And then after lunch, we'll come back for presentations 2 and 3. And then we have a coffee break from 2:15 to 2:30. And then we'll have presentations 4 and 5, followed by some coffee and networking at 4:30. So we're working to keep you guys well caffeinated here today. We do have a variety of food options during lunch, including special options for those with allergies who told us about those in advance. So just please read the signs so you make sure to get the correct food that's right for you. People are welcome to stay as long as they like after the final presentation today at the coffee and networking. But I do have to let you know that if you're taking the shuttle to the Graduate Hotel, the shuttles are going to depart at 5 p.m. From here. And then they will return tomorrow morning at 7:45 a.m. We have a bit of an early start tomorrow for the workshop itself. And then finally, before we get started with our first presentation, I just want to thank our sponsors for the Research Symposium and Workshop. That includes the R. Dudley Harrington Jr. Charitable Foundation, the U.S. State Department Bureau of Population, Refugees, and Migration, the U.S. Naval War College Foundation, the Wigian Foundation, UN OCHA, and the United Nations World Food Program. So thank you. All right. So we'll immediately launch into our first presentation, which I will be getting started for the first couple minutes. And this presentation is on humanitarian military relations and complex emergencies, evidence, insights, and recommendations. It's a really exciting project that we've been working on for the last 2 years, and are thrilled to have the first opportunity to present it in full to this audience here today. We'll be presenting pieces of it at future conferences, including HNPW in Geneva in May, as well as at a couple conferences this summer in Crete and in Ottawa. So firstly, in terms of disclosures, this research was funded by a grant from the U.S. State Department Bureau of Population, Refugees, and Migration. The funder had no role in the design of the study, analysis of results, or development of conclusions. And the opinions, findings, and conclusions stated here are really just those of the authors in our Center for Human Rights and Humanitarian Studies alone, and do not represent those of the United States government or any of the other agencies who we interviewed for this project. I'm really thrilled to introduce our presenters who are going to be presenting various aspects of this research today. They are really an incredibly accomplished group, and I'm going to present them right now all at the beginning so that we don't have to interrupt the flow of the presentation. So first we have Sam Boland, who is a global health researcher and consultant specializing in humanitarian and public health emergency response, with on-the-ground experience working in the Democratic Republic of Congo during the 2018 to 2020 Ebola virus epidemic. His own research focuses on civilian perceptions of military responses to public health emergencies, and he was responsible for all of the Congolese interviews during this project. Zain Tayeb is a humanitarian affairs officer at the United Nations Office for the Coordination of Humanitarian Affairs in Jordan and a global fellow of the Brown University Center for Human Rights and Humanitarian Studies. Recently, she has been supporting the Civil Military Coordination Service of UNOCHA in Istanbul with Middle East and North Africa operations and policy guidance on SIMCORD-related issues. And she organized most of the Jordan-based interviews. Dr. Maria Karin Alejandria is an associate professor at the Department of Sociology of the University of Santo Tomas in the Philippines and a global fellow of the Brown University Center for Human Rights and Humanitarian Studies. As a feminist anthropologist, she has been collaboratively working with urban informal settlers in negotiating with social institutions for inclusive development towards health justice. And she organized most of the Philippines interviews for this project. And then finally, we have Rob Grace, who is a researcher and affiliated fellow here at our Center for Human Rights and Humanitarian Studies. Much of his own research and work focuses on humanitarian access and negotiation. He is also a former fellow of the United States Institute of Peace. So in terms of the presentation today, we're going to start with some key empirical and conceptual gaps, and then the original research questions for this project. We'll then talk a little bit about the research design and analytic methods, and the ethics, risks, and mitigating measures. Keep the first part pretty brief because we want to definitely get to the results by case study, which will be presented by each of our researchers, starting with the results from the Democratic Republic of Congo, then from Syria and Jordan, and then finally from the Philippines. At the end, we're going to talk about some of the cross-cutting themes and recommendations to grow out of this research, and then finally have plenty of time for Q&A. So just to begin with some key empirical and conceptual gaps. So humanitarian military relation guidance assumes a dichotomy between natural disasters, as encapsulated in the most recent edition of the Oslo Guidelines from 2007, and human-made or anthropogenic disasters, encapsulated in the 2003 MCDA guidelines, as most of you know. This dichotomy doesn't reflect the reality and diverse contexts of many complex emergencies today, and especially the case studies we're going to be presenting here, where you actually have a blend of both natural disasters and human-made disasters going on at the same time. And even though UNOCHA published in 2018 an updated recommended practices for effective humanitarian civil military coordination of foreign military assets in natural and man-made disasters, which is quite a mouthful, which did try to incorporate these two different streams into one document, it still falls short in terms of guidance on the full array of relevant response contexts, including epidemics, pandemics, which we have realized recently are important, and forced displacement crises. In addition, the 3 C's that many of you are familiar with, this spectrum of coordination that goes from cooperation in the setting of natural disasters to coexistence between civil and military actors in the setting of conflict, is truly one-dimensional by its very nature and really fails to capture the issues of humanitarian access and negotiation, civilian protection, and aid worker security, which require actually more engagement between civilian and military actors, even as the conflict becomes more intense. And so this paradigm of civilian and military actors working together in natural disasters and then not speaking to each other at all in conflict settings or very limitedly in conflict settings really just doesn't work for the reality of humanitarian response today. In addition, the principle of last resort, which states that military assets should only be used when there's absolutely no civilian assets that can do the job possibly as well, really fails to account for domestic-led emergency responses, which we'll especially hear about in the Philippines case. More and more today, humanitarian response is being led by domestic governments, and many of those governments use their military not as the last responder, but as the first responder to not only acute onset disasters such as earthquakes or typhoons, but also pandemics and epidemics as well, which is an important piece of what we'll be talking about. And then the disconnect between HMR and recent policy discourse on humanitarian reform, as encapsulated in the 2016 Grand Bargain at the World Humanitarian Summit, especially related to localization efforts. So a lot of the great work that has come out of the Grand Bargain, a lot of the work that the rest of the humanitarian world is working on in terms of localization, hasn't made its way into the humanitarian military relations discourse. And then finally, there is a lack of a gendered analysis related to HMR, especially in light of military humanitarian power structures, which tend to be male-dominated, and then the prevalence of GBV and sexual exploitation, which folks are becoming more aware of within the humanitarian context, but still has not made its way into this discourse on humanitarian military relations. So our research questions that launched this project were twofold. First was directed towards humanitarian and military actors working in various humanitarian contexts within conflict zones. And that was what practices have been implemented to overcome the coordination barriers between civilian and military/security actors during humanitarian operations. The second question, very importantly, directed towards affected populations, so those who are actually affected by disaster and conflict. And we wanted to understand the relative perceptions held by crisis-affected communities interacting with or receiving assistance from military and security forces as well as humanitarian agencies. We have this sense, I think, especially in the humanitarian world, about what their opinion would be around getting assistance from humanitarian actors versus military actors versus other types of security actors, but really very little empirical research that has actually asked them this question at a large scale and tried to get the perspective from them directly. And importantly, when we started this project, we had no prior assumptions about what those practices should be or could be that have been implemented to overcome coordination barriers between civilian and military actors. And we also had no prior assumptions about the perceptions of those community members or what they should be or what they would be. And that allowed us to really use a very open-ended format to gather this data. So in terms of the design of the study, we chose 3 very different contexts around the world because we wanted the results to be as generalizable as possible. And those contexts include the Kivu Ebola epidemic in the Democratic Republic of Congo, which encapsulates epidemic response and conflict. Most of you remember the second largest Ebola epidemic in history happened in Congo between 2018 and 2020. And there were a number of controversies that came out of that in terms of how the response was led by both humanitarian actors and the role of military actors. And understanding how pandemic response works in a conflict zone was an important piece that we wanted to get at. The second was crisis in Rukban. So this specifically looked at Syrian refugees captured on the Syrian-Jordanian border. As you'll learn more about the case study, this really was focusing on mass displacement and what happens to people in these sort of no man's lands where nobody can get to, where no state has real control, and how does that affect humanitarian military coordination and those types of aspects. And then finally, in the Philippines, we originally planned to do a study focused on a natural disaster in a conflict zone. As you know, there's been a long simmering conflict in the Philippines. We wanted to focus on the Taal volcano eruption, but then the COVID pandemic happened, and that gave us an opportunity to actually also look at civil-military coordination in the Philippines in the context of conflict, both in terms of a acute onset disaster, the Taal volcano eruption, but then also the COVID-19 pandemic and its management in the Philippines, which was largely led by the Philippines government and specifically the Philippines military and other security actors. Just as a brief remark, when we talk about military, we include a broad array of armed actors, including local and international military, UN peacekeeping forces, national police, non-state armed groups, private security contractors. So we really look at that very broadly as any sort of armed actor, and that's also something that differentiates this from past research streams, which focus really on state-based militaries exclusively. In terms of humanitarian actors, we also look at this very broadly, including not just big international humanitarian NGOs, but also local NGOs, public health agencies, local government agencies, and other contractors working for local government agencies. And infected communities includes both community leaders as well as community members. We were careful to interview them separately, and then also made some efforts towards ensuring perspectives of women and minority groups in each of these sites. So in total, we completed 175 interviews across these three settings and across these three different types of actors, and you can see the breakdown here. Importantly, we were unable to obtain interviews with either Syrian or Jordanian military, despite our best attempts focused on the Rukban population, though some of the humanitarian actors that we did interview related to Rukban were previously with the Jordanian military. In general, we had fewer military interviews, as you can see, compared to the humanitarian and crisis-affected community interviews. This was partly due to access, but also due to reaching saturation much more quickly with the military actors, who tended to have more similar responses to questions as opposed to humanitarian and affected communities whose responses were much more varied, requiring us to capture more individuals. We then analyzed the data from these 175 interviews. I mean, firstly, they were all transcribed and then translated, because most of them were done in foreign languages, either Arabic or in Filipino. Or in French. We then went through the transcripts and we coded them using a grounded theory analysis, which basically makes no pre-assumptions about the analytic structure of the data. We really let the individuals who were interviewed tell us what the themes were. We then went through the process of writing memos for each of the contexts, and then compared the themes across these different contexts so we could come up with themes that were similar and united across these different contexts. In terms of ethics and risks, we gained ethical approval from all necessary entities, including the Brown University Institutional Review Board, which was accepted by authorities in Jordan, and then separately from the University of Kinshasa School of Public Health Ethics Committee in the Democratic Republic of Congo, and the Philippine Social Science Council in the Philippines. Risks included insecurity and limited research access, which obviously made it difficult. We relied on local researchers in all of these contexts, especially for the interviews with affected communities, which helped us gain access. Interviews with some of the humanitarian and military leaders we were able to do via Zoom or other online platforms. COVID-19 pandemic popped up just as we were starting this project, and that obviously provided its own risks and limited travel directly to some of these settings, which is partly why we are so lucky to have local researchers and even local coordinators in each of these settings to help organize the research. And of course, the primary risk with research such as this is a loss of confidentiality of especially sensitive information, especially from affected community members. So mitigating measures included voluntary participation and informed consent from all 175 people that we interviewed, also ensuring that we kept the interviews confidential and de-identified all statements afterwards before analysis. And with that, we're going to start with the first presentation of research from Kivu.
Thanks, Adam. Half a second here. Hi, everyone. So my name is Sam. I'm primarily associated with the London School of Hygiene and Tropical Medicine. I also worked for some months in the Democratic Republic of the Congo during the 2018 to 2020 Kivu Ebola epidemic. And so that's what I'll be speaking with you about today before handing it over to discuss some of the other case studies. So the DRC has actually had 12 outbreaks of Ebola that have been recorded as of this month. They do crop up from time to time. There's been one just before and also since the 2018 to 2020 outbreak. But the Kivu outbreak remains the country's largest. It's also the second largest recorded, only following the large West Africa Ebola epidemic from several years prior, between 2013 and 2016. The outbreak predominantly affected the eastern provinces of Congo. You can see them highlighted in dark gray on the map in front of you. That's North Kivu and Ituri, and then a smaller number of cases in South Kivu, and just a small handful of them in Uganda, which is just across the country's border to the east. The region of Congo, many of you will know, has a history of really profound disruptive conflict. Really noticeable in the late 90s and early 2000s was the Second Congo War. There were literally millions of excess deaths that were recorded in this area. The area is also affected by the Kivu and Ituri conflicts, which are ongoing since the early 2000s. And essentially what that means is that there's low-level violence, conflict, and insecurity really throughout the region. In some locations, more than 99% of households report at least one member being subject to violence or displacement. And as a result of this really unstable, violent, and dynamic context, there's a history of lack of trust in government and public authorities. And this lack of trust was really compounded in the outbreak, particularly when the president at the time decided to cancel the upcoming presidential elections in the affected region, citing Ebola as the reason that elections could not be safely held. And so those people were disenfranchised, and they were told it was a result of the ongoing Ebola outbreak. So the WHO, and I'll get to these armed actors in a moment, there's a quote here from a senior WHO representative which sort of encapsulates a bit of this idea of the kind of terrain and context that we were working with. And they said that the response to the outbreak was led by the Ministry of Health with support from the WHO and partners. Challenges in establishing trust with affected communities, reticence for admission to Ebola treatment facilities, a high level of insecurity due to the presence of armed groups in the affected areas, as well as a series of attacks against healthcare workers, contributed to the difficulty in containing the outbreak. Which leads us to the armed actors that were there even prior to the Ebola outbreak, that were there either contributing to this insecurity or there to try to respond and contain it. In the area, it's really hard to convey the extent to which this is the case. There are myriad armed groups. There are, most people think, at least 70 and possibly more than 100. That includes, the vast majority of those are non-state armed groups under the heading Mai, which essentially just means a community defense militia. They range from a small number of people to relatively well-organized and armed groups of several hundred. There's a really notorious non-state armed group, which is the ADF, the Allied Democratic Forces. That's an Islamist terrorist organization. And there's an ongoing insurgency, and there's some sort of contemporary work that Uganda is doing to try to respond to that as well, because it's right on that Uganda-DRC border. To respond to that insecurity, there is the largest UN peacekeeping force in the world, which falls under the acronym MONUSCO. And they work with governmental armed and security actors, primarily the National Army, that's the FARDC, as well as the PNC, which is the armed police of Congo. These actors in the response, and I won't go into a huge amount of detail now, but feel free to ask in Q&A, performed a number of different roles in the response. Some were quite disruptive by causing insecurity and at times even attacking members of the response and response infrastructure. Others were in many ways supportive. MONUSCO, for example, provided a lot of logistical support. The FARDC was responsible for providing on-site security and armed escorts, although very controversially. So the real question then becomes, what were the CivMil challenges that were raised as a result of this sort of milieu and this complicated environment that we were working with? And so, as discussed, that was broken down into three categories: the civilian Ebola responders, the military and security Ebola responders, and then affected communities. So in a response to the protracted conflict and the difficulty, especially as exacerbated by that decision by the president to associate the Ebola response with disenfranchisement in eastern Congo, there was a very troubling and insecure landscape on which CivMil issues had to be negotiated by civilian response actors. And these actors were actually most likely of the three groups to raise concerns directly about the role of armed actors, especially the FARDC, the Congolese army, as in their role, in particular about their role performing armed escorts and site security outside of the response's infrastructure. This was felt by civilian response actors to essentially eschew the humanitarian principles, as well as to threaten and continue to further community mistrust, which in response to a crisis like this is often held up as one of the most important things that we can have, that one can have in order to effectively respond and contain an outbreak. That in particular was felt to be significantly exacerbated itself by the often informal cash payments which were made by some responding agencies, including civilian agencies, to the FARDC and the PNC for the provision of those armed escorts and security. Despite these concerns, a large minority of civilian responders did feel armed actors provided necessary security to continue to safely operate the ongoing response. That was particularly the case after 2 MSF facilities were attacked concurrently in the epicenter of the outbreak. Other civilian responders highlighted the dilemma that this really represented about the need to collaborate with the Congolese government, which decided unilaterally, but as was their sovereign decision, to place armed actors outside of facilities thereafter. And different civilian agencies responded in different ways. Some decided that that was anathema to their ability to operate, and they decided to leave. Others decided to somewhat embrace the new reality of the situation and to proactively work, even quite openly, with those armed actors. And others took a more middling approach where they remained in situ and they maintained the humanitarian principles to the extent that they could, but nevertheless did cooperate with military and security actors if and as required by the Congolese government. Just to put this in perspective, as pictures help, this is 2 photographs that I took while I was there, the morning after the MSF Katwa Ebola Treatment Center was attacked. And it, as you can see, was extremely disruptive, and 48 hours later, a facility about 5 minutes down the road was also attacked and badly damaged. I think 2 quotes are particularly poignant about trying to identify the balance between these civilian responder perspectives. This first one simply says, "I think the world is moving away from the so-called supposedly golden age of humanitarianism, where humanitarian organizations could pick a piece of territory and pretty much act without much engagement from the government. That's less the case with the world today, so I think we need to get much better at working with governments. What we've seen in public health emergencies will be more and more the future for all of the work of aid as governments across the world reinforce their capacities and want to have a much greater say about what goes on in their territory." And I think this is particularly true now with the COVID-19 pandemic, which is something, again, I would encourage you to raise in Q&A. There's one other brief comment just to sort of provide a bit of a counterpoint to this sort of quote-unquote pragmatic approach or public health approach. Another civilian responder said, "I think the core issue is that the epidemiologists, the public health responders, focus on one thing, which is killing the virus, and they think that everything else is irrelevant. The consequences to what you do in order to do that is irrelevant because the only thing that counts is eradicating the virus. So they do not see the bigger picture and they do not see the impact." I'm going to quite quickly move through the perspective of armed and security actors. And the reason is because most of those that were interviewed generally saw their role as essentially service providers as being tasked by either the UN or the national government. They did not necessarily see their roles as particularly controversial, but my understanding going through the interviews and the data was that was partly the result of the fact that they were doing what they were asked to do. People were therefore somewhat more neutral and circumspect in stating whether their role was or was not problematic. Many did raise several perceived challenges related to the establishment of a sort of parallel coordinating structure called UN-ERO. There was some conflict or disagreement between that and some other response actors. But generally speaking, there was quite a reserved point of view. It is important to note that unfortunately it was not possible to interview members of the Congolese National Army. I can talk about some of those limitations or why that was the case again during Q&A as that comes up. So finally, and in brief, to move on to the perspective of Ebola-affected community members, these are really ostensibly the beneficiaries of the Ebola response. These are the people that are there, and all of these other civilian actors and many of the military actors are there to support. I think, perhaps counterintuitively, Ebola-affected community members were actually more diverse in their perspectives on the role of some armed actors in the response. Many raised concerns, some significant, including specific instances of violence which plausibly amount to human rights violations. A roughly equal number referenced their appreciation for the support of some armed actors in the provision of security to local responses. Of note, and a really unique and interesting perspective, was the extent to which various non-state armed groups were felt by Ebola community members to have supported and contributed to the Ebola response. And that ranged from the provision of localized security to local Ebola responders at the sort of village level and sub-village level. It even also included public influence campaigns and public health programming, including the encouragement of communities by the networks and structures of those NSAGs to actually, for example, proactively encourage people to go out and get vaccinated. Other groups were felt to be harmful, particularly the ADF, which was felt to be extremely violent and disruptive to not just the response, but also to local communities. And I think one other significant and noticeable finding is the extent to which Ebola-affected communities were almost entirely unaware of the role that MONUSCO, the UN peacekeeping troops, were playing supporting the response, which I think is notable provided the extent of that support, albeit in the sort of backgrounded way through logistics and airlift and the like. While there was a lack of consensus about Ebola-affected communities over whether armed actors had an overall positive or negative effect, like I said, it was pretty much cut down the middle, there was a very clear consensus about the need for better inclusion and also ownership of the response at a more local level. So at least those decisions, including about the role of armed actors, could be made by those who are directly interfacing with each of the different elements of the response. And this final quote, before I turn things over to Zain, I think really captures that idea. And this Ebola-affected community member said, "I don't think that there is anything to point out as a mistake related to civil-military engagement. However, it should be noted that the local population was almost absent from the fight against Ebola. We can certainly count on the outside, people from outside the affected area, but the success of any action depends more on local and endogenous commitment. This was not the case in the Ebola response process. If there were, for example, the involvement of local authorities and civil society organizations here locally, we would not face popular resistance. Here young people can be easily manipulated. And to force the population, we need the intervention of local leaders because they are listened to more than anyone else in this territory." So I'm going to move on from the DRC context and hand things over now to Zain to discuss the crisis in Rukban.
Thank you, Sam. Thank you, Adam. Thank you, everyone. So my name is Zain. I am a humanitarian affairs officer working with UN OCHA, and I am currently supporting the Civil Military Coordination Service in Istanbul, along with my chief, who's sitting there, Bediako. It's been really a pleasure to be part of this study. We are going to discuss the crisis in Rukban and its implications on the people, on the humanitarian actors, and on the military and civilian relations. So the crisis in Rukban, for those of you who do not know Rukban is an informal settlement that lies between the Jordanian northeastern border and Syria. So it's in the what's so-called the no man's land. It's a very hard to get to access area, and it has dire conditions. The situation is not easy. The weather conditions are not easy, and people do not have access to the services, the basic services, or clean water or food. And so it pains me to say this after 11 years of the Syria crisis, that there's still no solution, no political solution on the humanitarian situation in Rukban. There were so many events that happened since the beginning of Rukban after the Syria crisis. So if you look at the map here, you will see where Rukban is. So when the Syria crisis happened, after 3 years of the crisis in 2014, people started going toward Jordan through Rukban, Hadalat, as you can see on the northeastern borders. There were some key events. So in 2014, the initial settlements began, and then in 2015, the humanitarian organizations started humanitarian assistance and humanitarian deliveries, such as MSF, such as ICRC, and some UN agencies. Unfortunately, in 2016, there was a suicidal attack, terrorist attack carried out by ISIS, and it targeted the Jordanian military base and resulted in the death of 6 military Jordanians. In 2017, after the attack, 1 year after the attack, of course, Jordan has closed its borders fully after the 2016 terrorist attack, and then it was basically there was no access to the services, there was no access to Rukban anymore, and so in 2017 the UN opened a service area. Actually, it was late in 2016, but it officially opened in 2017, and there was a UN health clinic that really treated the patients or did some referrals to the hospitals to Jordan. In 2018, there was the humanitarian crane operation because of the hard situation and because of lack of access, and we will come to that. And in 2019, the UN started the plans for departures and evacuation plans for the population in Rukban. In 2020 and 21, and due to COVID-19, the clinic was permanently closed. It was really hard to go to Rukban, to access Rukban in any mean. Until today, unfortunately, things are still the same. So if we go through the crisis context, the securitization and closure of the northeastern border, and that's basically happened after the 2016 attack. Before that, the UN could deliver assistance, they could have access to the people in Rukban, and they could provide aid, they could provide food, they could even provide education services. But in 2016, once the attack happened and everything closed, the Jordanian Armed Forces, which is the JAF, decided with the government of Jordan to close the borders and to just limit the access of the UN workers to only be to the UN service area and the health clinic. So people were really, they had to go some evacuations from where they were inside Rukban to get to the service area or clinic for further screening. And so there were some relief convoys still and return operations, but it all happened as cross-line operations from Damascus because it was impossible for humanitarian people, humanitarian workers in Jordan to get to Rukban. So the best way was to send humanitarian convoys and relief items through Damascus and through the Syrian Arab Red Crescent, which is the SARC. And of course, there was what we did back in 2018 was a crane operation. It happened twice, in 2016 and in 2018. So if you look at this picture, because of lack of access, the only thing that was doable was to basically use one of the cranes through the management of the Jordanian Armed Forces and deliver food items and basic needs to the other side of the berm through the crane. of course, in coordination with the community leaders and the tribal leaders inside Rukban, because Rukban hosts, now it hosts some 12,000 people, but back in 2016, 2017, it was home to over 60,000 people. And with the closure of the borders and with other humanitarian conditions, people began to really to go through the evacuation process, and now we're only talking about 12,000 people, but I mean, this number seems a little bit small, but in fact, when there's nothing there, when there's no clean water, when there's still issues of really dire conditions, it's a large number. So I did have the pleasure of interviewing people that lived in Rukban. It was both a challenge and a rewarding experience because some of them appreciated the fact that they were transferred into the refugee camps in Jordan. Unfortunately, we couldn't get to Rukban for interviews, but we still managed to interview people that were part of the Rukban community and were transferred into the refugee camps in Jordan. So one quote here: when they used to bombard us at night, my little girl would be terrified. And you can never tell if the missiles are hitting your house or your neighbors. This is what made us leave, these night bombardments. It's a difficult life. Imagine your child wakes up in the morning and asks for bread, just a slice of bread to eat with nothing else. And you tell them to be patient till you get them something, but there's nothing to get. So the reason why they left Syria was because they lost everything. They lost their house, they lost their food, they lost their everything, and it was still very unsafe for them to stay, even with families. And so that's part of what they left. I mean, they left to other dire conditions, but for them, what mattered the most at that point is securing their families, securing their children. And when they crossed, they had a very negative perspective about military officials and military actors. But when they crossed into Jordan, they felt a sense of relief when Jordanian military were helping them cross, were providing first-hand humanitarian aid and delivery, and of course, sending them to the proper shelters with UNHCR and other humanitarian organizations. So here's another quote: once you saw a different military uniform, then you relaxed. You know you were on the safe territory. When we saw them, there was a feeling of safety, like we arrived and crossed safely. The treatment was very nice, like welcome, welcome. If a person had a young girl or a boy, they would help carry them. If they saw an elderly woman, they would help her. Here in Jordan, we felt comfort and safety. There in Syria, they used to curse and hit, whereas here in Jordan, they're extending a helping hand. So that's really relieving to hear, although there were some other perspectives about Jordanians, some negative ones, but the most common were in general positive. So humanitarian and armed security actors. So in Rukban, most of the Rukban population are from Homs, from Palmyra, from southern Syria. And so there are lots of tribal groups and tribal communities, and that resulted in the eruption of non-state armed groups, factions, and some of which are affiliated with ISIS. Of course, for us as humanitarians, it was really difficult because in Rukban, there's no one player. It's always multiple players. You have the government of Syria, you have the US, you have the Russian Federation, and there's also the government of Jordan, So it was hard to make one decision. And we had to compromise some of the principles that guide our work, unfortunately. So whenever we want to deliver or plan a humanitarian operation, we had to go through the Jordanian armed forces, through the government, through the coalition forces, just to get their buy-in and to get their guidance on who to contact. And most of the contacts referred by the government of Jordan were those groups that are pro or allies with the Jordanian armed forces inside the camp. For instance, when we planned for the crane operation, we did flag that it was hard for us as humanitarians to monitor how the distribution of humanitarian aid was going to be, because we only had eyes on the side that we were at. And so when they when they delivered it to the other side, they delivered it to the tribal community. I'm sorry, what? They delivered it to the tribal leaders, who then basically distributed goods and basic needs. So we didn't really have any idea of if the humanitarian needs or basic needs were delivered to the right people in the right time. So, again. So information sharing and the role of local actors, like I said, it was basically communicating with the JAF, but through their allies from the camp. And and whenever we planned a humanitarian operation, then we also needed to get their buy-in, to get their approval to facilitate our access in the camp. And lastly, gender. Gender was something that was really highlighted and flagged and shaped our work in Rukban, because it was really hard for us to plan everything with the Jordanian military. I mean, most of the Jordanian military officers, especially senior officials, are men. So it was really extremely difficult to get their approval on everything, especially related to women and children. So one quote, and I think the UN in general all over the world now is really pushing and advocating for the prevention agenda. I think it's very important, and then of course empowering the community to become self-resilient for any potential crisis, particularly those we expect to be most affected by crisis: women, girls, youth, and adolescents. It's really important, so I think the element you should focus on for any future crisis. I'll stop there. I'll hand over to my colleague, Karine, who will then take us to the Philippines. Thank you.
Thank you, Zain. Good morning, everyone. So I have 10 minutes to present two crises. Please bear with me. All right, so I am presenting the case from the Philippines focused on the eruption of Taal volcano and that of the COVID-19 pandemic. Adam has generously discussed earlier why we had to do COVID-19 as part of our scope as well. So the Philippines ranks among the world's most vulnerable countries to natural hazards. It regularly experiences typhoons, earthquakes, large-scale floods, and landslides. We are within the Pacific Ring of Fire. Our country is just right smack in the middle of hazards, rather. So in 2020 alone, Filipinos faced not only the Taal volcano eruption, and the COVID-19 pandemic, which is the focus of this presentation, but also multiple typhoons, including Super Typhoon Goni and a 6.6 magnitude earthquake. In fact, just 2 days ago, while I was taking my trip here, Taal volcano started spewing ash again, and so the government decided that we should raise the alert from alert level 1 to alert level 3. So when I landed in the U.S., it's alert level 3, and they're evacuating people already. So I was even joking to friends that well, is this like marking the end of our project? It's like full circle now. So further complicating the Philippine narrative is the multiple protracted non-international armed conflicts that have persisted for decades, driven by a range of non-state armed groups. Considering the country's vulnerability to natural hazards, as well as the continued political instability, the Philippines has undertaken extensive efforts to build up its domestic capacity for disaster response. These efforts have included the creation of a national cluster system modeled after the UN Humanitarian cluster system. You have to be very patient with me because I'll be moving from one crisis to the other. So they're properly labeled anyway. So so here we have a discussion more like locating what happened in Taal eruption and that of the COVID response. So the first crisis is the Taal volcano eruption, and Taal volcano is located in Batangas, which is a very popular tourist destination for diving. Should you decide to come to the Philippines, now is not the time. So going to that, it is about 50 kilometers from Manila, which is the center which is the capital of the country, and it is south to the most populous city in the country, which is Quezon City. The volcano erupted on January 12, 2020. That was just three days before my birthday. I thought there was like kind of a snow going on, but no, that's not it. It's the ash. So the eruption led to the forcible displacement of over 300,000 people. And this disrupted critical infrastructure, including transportation lines, power, water, supplies, and such. And the damage cost 14,000 homes and by the evening of January 12, the government had declared a 14-kilometer hazard zone. I have to make a note here that initially there was a discrepancy in the hazard zone. Initially, it was about 12 kilometer, and then so people moved there, and then later in the evening, they were told, no, it's 14, so they had to move again. So there were those kinds of discrepancies in the disaster management. So the volcano erupted again on July 2, 2021, right at the thick of the COVID pandemic in the country, which displaced an additional 22,000 individuals. At that time, we were, I'm technically part of the Department of Health in our country, and at that time we were very worried because we are putting so many people in evacuation centers, and of course COVID is also a threat. So it became a very complex hazard. The second crisis is the COVID-19 pandemic, and this began just 10 days after the Taal eruption. So you can just pretty much imagine what was going on in my country at that time. We just had the eruption, and then the government declares, oh yes, now we have COVID. And so the first death that we acknowledged in the country was on March 12. And at that point, the President Rodrigo Duterte announced a community quarantine that would apply to all of Metro Manila and later on the northern part of the country, which is Luzon. The Philippines has been reported to have the record for the longest lockdown in the world, having been only lifted last month. So by the end of 2021, the country was hailed as one of the worst places to be in during this pandemic. Of course, this is highly contested by our government because our government says that we have the best pandemic response. So moving on. I hope I don't get into trouble. So anyway, so these are the roles that were performed by the uniformed personnel in the country. So I had to do a more like a table, and I'm sorry about that. It's just that I wanted to make sure that we get a clear comparison of the shift in their role. So you can see here all the roles that were performed by uniformed personnel, whether they are Bureau of Fire Prevention, Armed Forces, Air Force, all the uniformed personnel. So comparing the roles performed by the uniformed personnel during the two crises, it is clear that they had a more diversified role during the Taal response. Notice that they have provided even psychosocial support for the survivors of the eruption. Community participants even mentioned of the members of the Armed Forces Band playing music to alleviate their suffering. Unlike in the Taal response, the role of the uniformed personnel for the country's COVID-19 program centered more on providing security and medical assistance and transporting relief supplies. It is important to note that on top of all of these roles is their key function to address the threat of non-state armed groups, especially with the enactment of the Anti-Terrorism Act of 2020. This last line is crucial because in my entire presentation, the concept of checkpoints, which I don't know if you have an understanding of it the way that we have in the Philippines, but checkpoints are very crucial for security. So every, at the height of the pandemic, every street corner has like a uniformed personnel with high-powered weapons checking everyone who enters that street. So that is how difficult the situation was. So how did the community members respond to, how did the community members perceive the response of the government, specifically the military actors for the Taal? So here we can see several dissatisfactions that they've had. I'm not going to go through each one of them, but they centered more on the delay of their response to the needs of the people who were evacuating. In fact, what's interesting that happened is that the government response was so delayed that most of the people evacuated on their own based on previous experience. So it was more like an oral tradition that got passed on, that when this is the intensity of the earthquake, you better evacuate, or when the smoke is this much, then you have to evacuate. So the information that they have to evacuate came much later. And then, of course, the military actors who were supposed to do a rescue operation came in a bit late. And of course, this was, according to the military actors, this was because the roads were blocked. But for the community members, all they remembered is that there were only few of the military actors who were trying to save them. So another thing that was highlighted in the discussions is that of the misaligned relief supplies. And this created a lot of problems in the management of evacuation centers. You see, what happened was that there were some evacuation centers that had so much relief supplies coming their way, and then there were other evacuation centers that did not have as much. So what happened was that other evacuees would tend to choose an evacuation center, more like trying to get as much as they can. But so there was another discrepancy in the distribution of relief supplies. It became even viral in our social media because one person, I remember this very popular news, because one person posted a picture of himself saying that I was able to start a mini grocery store because he had all the canned goods in the world, and while others did not have as much. So despite expressing dissatisfaction with various aspects of their response overall, research participants generally spoke positively about the uniformed personnel. Indeed, research participants perceived that the presence of military in the communities promoted peace and order. This is going to be starkly different from the COVID response. So I'd like to highlight that in the Taal response, the military actors were saviors. They just had conflict with them when they were not allowed to return to their homes, but they shouldn't be returning to their homes because the hazard was still there. So military actors were considered bringers of relief. But in the COVID response, it was totally different. So the community members noted in the interviews that there was an observable panic among members of their community when the government began introducing quarantine measures in March of 2020. This reaction was driven by community members' concerns about mobility restrictions to basic services. We were not allowed to use public transportation at all because, well, technically the public transportation did not exist at that time. So just bringing in some class-based analysis here, only the middle class kind of thrived during this time because we had our cars, and then of course the poor and those below poverty lines suffered so much, especially in food security. So this is exacerbated by the heavy presence of uniformed personnel, which I was telling you about earlier with high-powered weapons. They're not just carrying pistols, they were carrying armalites. I don't know the technical term for that, but they're carrying those stuff. So altercations between civilians and uniformed personnel have also been reported. Several civilian participants discussed instances of gendered harassment in encounters with uniformed personnel. The worst that was recorded was that of a sexual assault to a woman who was passing through the checkpoint. And there was also this highly discussed case of a retired military personnel who was killed by a group of military personnel as well because of some misunderstanding due to quarantine protocols. So participants also noted that they struggled to distinguish between the uniformed personnel in terms of their identification with the military or the Philippine police due to the parallel usage of camouflage for checkpoints. What you're seeing right here, the blue one is the typical uniform of our police. But during the pandemic, they were made to wear these blue uniforms, which kind of complicated the whole identification of where they belong to. So a footnote to this is that majority of the reported cases that were troublesome were reported about the police, but since they were wearing this, they were associated with the armed forces. So participants noted that they had multiple. That they saw multiple uniformed men, and they were in full battle gear. And this did not only promote confusion, it also became a threat. They felt threatened by it. So members of the police who participated in this study have also discussed how civilians are generally on a defensive mode when they are implementing quarantine protocols. So it's animosity between the two groups. Now, for the humanitarian workers, so the civil societies in our country supported the government, worked with the government in providing basic services, basic needs of those affected populations. Civilian responders discussed the sense that the response had been overly securitized, spanning the full spectrum of the response. You see, the heads of our COVID response are all, most of them rather, not all. Most of the head of our COVID response are military generals, and so there was that over-securitization of response, and they felt that because of that, the threat was too much to bear for most of them, especially that even doctors were being stopped in checkpoints when they deliver services or care. So. So I have 1 minute. So good practice. I don't want to leave with just a bad information about this, but because there were highlighted good practices here. One is that they were well trained for disaster response, and that the other one is that there were acts of humanity that they performed, from the uniformed personnel donating their own salary to mitigate the resources that are lacking, to even providing houses for those that are affected. Lastly, challenges. So the challenge here is that there is a less nuanced approach in disaster management. So, which means that in most cases, there's like a template of how to respond to disaster, and with that, it becomes problematic because, as you would have seen, the pandemic needed a different approach than, for example, a natural hazard, and it gets a whole lot more complicated because of the political environment that we are in right now, wherein the police are not only or the uniformed personnel are not only trying to serve as humanitarian actors while they're on checkpoints, they're also trying to check if you are part of a non-state armed group. So there is that very tense atmosphere, and this complicates the whole disaster response. Thank you.
Okay, so those are 3 case studies. I'm going to conclude our presentation by offering a few final comments to tie it all together, articulating some cross-cutting themes and recommendations and some comments about what all of this means for the broader field of humanitarian military relations and what can we take from these case studies to apply as we move forward. First insight is just the notion that when we're talking about humanitarian military relations, we are really talking about something that's much more holistic than it was classically thought to be. We're talking about a very expansive scope of types of armed actors. We're talking about international militaries, domestic militaries, non-state armed groups, police, private security actors. We're talking about a wide scope of response context. We're talking about complex emergencies, natural hazard response, public health emergencies, responses to forced displacement, and in terms of the substance of the engagements between civilian responders and armed and security actors, it spans a wide scope of thematic areas, talking about the use of the military in disaster relief, but also issues of access, security, and protection. Linking this back to the comments that Adam gave at the beginning of the presentation, we have this 3 C's framework, this spectrum that brought a certain degree of coherence to humanitarian military relations across different contexts. With this more expansive view of what humanitarian military relations is, that framework no longer captures all the nuances and the details. So what we see is humanitarian military relations being right now a field in search of a new coherence. So that it would be beneficial to devise a new typology for thinking about humanitarian military relations across different types of contexts and across different types of armed and security actors. So I'm very happy to say that based on the data that we have collected, we are going to be creating such a typology. That's how I'll be spending my summer. Second theme is that there was at times evidence of incongruity between what responders were talking about and thinking about and what the crisis-affected community was perceiving as very important, especially in DRC and in Rukban. In DRC, we have responders having debates about the use of armed escorts. In the Rukban situation, we have humanitarians having debates about humanitarian principles and whether accepting constraints on access would be compromising too far, compromising the humanitarian character of their work. But we do have evidence from some of the interviewees that they did not care about these issues. They have immediate needs that they want to be attended to, and in many cases we're actually very appreciative of the role that the military played. In the case of the DRC, appreciation for the role of security in the Rukban context, and appreciation for the role that the Jordanian armed forces played in receiving refugees from Syria. So it's not that all of the SimCourt principles, last resort, humanitarian principles do not matter, but it's a question of of why and how they matter, and rooting the sense of why and how they matter in an evidence-based sense of putting the local population at the center. So that sort of that's our recommendation here, is placing the crisis-affected community at the center of thinking. And this is a recommendation for us as researchers as well in research on humanitarian military relations. There's very little data gathered about perceptions of crisis-affected communities. There is some, but very important to make that evidence-based more robust. And it links to this parallel policy discourse, as Adam also mentioned in the beginning of the presentation, that's been going on in the humanitarian sector and has gained a lot of increasing attention in recent years on localization and even decolonization. And we find in our analysis that there's a benefit to linking these two strands of policy discourse, one being humanitarian military relations and all the issues we face there, but also the issues of localization and decolonization. How do they intersect and interact? Third point is to emphasize the gender dimensions of humanitarian military relations. In our presentation and in our report, we laid out some of our preliminary thinking about how our data shows that these issues are important and should be brought more deeply into humanitarian military relations, but we know there's much more to explore there as well, and that is another strand of thinking that we're also interested in pushing forward, and it points to the importance of more deeply infusing gender analysis into guidance, planning, and analysis. A final point is this issue of navigating compromises on principles, SIMCORD principles, humanitarian principles. Traditionally, when we've thought about humanitarian military relations, we think about building relationships between civilian responders and military actors so that they can share information with one another, they can understand one another's capabilities and limitations and the ways that they operate, so they can build personal relationships with one another in workshops, for example, so that when they meet out there in response context, they already have a pre-existing relationship. And using all of that as a means to sensitize one another on the principles of humanitarian civil-military coordination so that those principles can be implemented. And that is important, yes, but another dimension is this question of how civilian responders in particular can and should respond in contexts when implementing those principles is not possible. The Rukban situation is an excellent case of that. It's a heavily constrained access environment, and different organizations made different decisions about the compromises that they were willing to accept. We see that as an important aspect of humanitarian military relations that deserves more attention. It raises the question of how to make these modes of thinking about these ethical compromises more concrete. The notion that it requires a very systematized and structured internal discussion within humanitarian organizations, but also discussion across organizations about how to navigate heavily compromised environments where principles are not possible to be implemented as they're intended to be. A few final additional recommendations. One is to continually adapt and resource evidence-based guidance. Another to continually adapt and resource evidence-based planning. I think we all know this. I probably don't have to convince you about the importance of this, but it is true that in all three of the contexts that we looked at, we saw responders in need of more actionable and effective guidance and in need of more actionable and effective planning. A final recommendation is to leverage research toward innovative conceptual thinking and knowledge sharing. This is where we come in. But this is where we all come in terms of what we're doing here this week, today, and in the following 2 days of the workshop. We are here this week working on building an ecosystem, and a community of practice in the field of humanitarian military relations. And our data showed that in all of these three contexts, we found responders in need of such a community of practice. So I think it's worth highlighting that humanitarian military relations as a practice and as a field will only be as effective as this community of practice is able to be robust, and as we are able to continue to make it grow and attend to it. I will leave it there, and we will all look forward to your questions and comments and reactions. Thank you very much.
Thank you so much to our team of researchers here. And now we will open it up for questions from the audience. So please just raise your hand. Alexandria has the mic and we'll bring it to you.
I'll break the ice. My question, Paul Murray first from United States Southern Command. My question is for you, Sam. You highlighted the two attacks on the clinics that were providing Ebola treatment. Could you elaborate on what the causes were, what you knew about it, and how that tells us more about what the underlying issues might have been in the DRC? Thank you.
Yeah, it's a very good question. Do we have mics on? Pardon me for the technical question. I know people can hear me, but I want to make sure it works for the live stream. It's not clear if the... There we go. Very good question. So I was there personally at the time. I say there, I mean in DRC. I was in Goma, which is about an hour helicopter ride away, when the attacks on those two facilities occurred. One happened, and then a couple of days later, the second facility was attacked. There was a lot of ambiguity at the time. There was an understanding that it was relatively well organized because a number of people, I believe it was about 100, showed up all at the same time, encircled the facility, and then proceeded to attack it and burn down a number of its sort of different triage areas. And one of those photographs was the storage facility at the back. I do not know personally. I remember there being some very high-level kind of back-channel conversations looking at trying to dig into the intelligence as to why exactly that particular instance happened and by whom. But I think that the general sort of nexus of the conversation seems to coalesce less about, you know, which particular My group was that perceived to be, for example, and more to do with the a recognition of the various different factors that sort of together built up to a context which was so unstable with such a depth of mistrust between populations and the response. And that included, one thing I referenced was the significant politicization of the response by the national government when they decided to essentially disenfranchise the population, noticing conveniently that the locally affected areas were also the opposition stronghold. But in addition to that, a really significant and I think fairly legitimate concern was the amount of money that was flowing into this particular area. These are areas of the country that have been affected by crisis for decades. This is far from the most serious recent or significant crisis that these populations were facing. But that being said, it was really the first time that they saw this sudden arrival of such large numbers of different, including international actors. The WHO, for example, had 300 vehicles in the area of those two treatment centers, and each one of those was $100 a day. And the amount of money spent on any one person in Congo on health in a year is $2. So when it comes to people's association with the response and what might be the priorities of the response, I think it's pretty easy to connect why someone might connect essentially corrupt business practices, whether or not that's actually happening. I think it's easy to see why someone might think that it is. And there was also allegations specifically that people that might be gaining financially from the response, whether it was people renting out vehicles or hotels or what have you, had somewhat of an incentive actually to allow the outbreak to continue longer than it might have otherwise. I'm not saying that that's what happened, but these were certainly the conversations that were occurring. The long and the short of it is that as a result of that, the two facilities that were both run by MSF actually lost that partner. They were built by MSF, they were staffed by MSF, and MSF left. And pretty much overnight, there was a decision to bring in the WHO, very much under the direction of the Ministry of Health, to operate those facilities. And there was a simultaneous decision by the Ministry of Health as the national actor to place armed security outside of both facilities. And I think that it really does raise a lot of these really, key core themes that we're talking about the extent to which you do or don't navigate compromises on these principles. To adhere to those principles meant the organization of MSF was not able to operate and not able to provide that life-saving assistance, but for the WHO to be there meant that they were associated very directly with the FARDC, the National Army, and that caused all sorts of problems for them thereafter, though the facilities were able to continue operating. Again, there was that sort of split when it came to how Ebola-affected populations felt about that. Some, including those who had been in those treatment centers, were quite clear that they really wanted that armed security outside because they did not feel secure inside those facilities without that. Others said directly that they had family members who died because they wouldn't go to a facility with armed actors outside of it. There wasn't really any clear way of trying to navigate that issue, and at the end of the day, it was the decision of the government to do that, and so that's what was done. That hasn't really come close to answering your particular question. I've kind of just hazed around why it might have happened and also how one might sort of respond to address those particular issues. But I think the takeaway from that is that I don't know that there is a more cogent or clear answer that you're going to get. It's a highly dynamic and complicated issue, and I don't think that there was a right or wrong way to do it. And that's why we're all here today, because it's a hot topic issue, and a lot of people feel very strongly on one side or the other of that coin.
Over here.
Thank you. Hi, I'm Sarah Furman with CARE, and coming from an organization that is very interested in gender equality, I was happy to hear that you all are looking at adding that gender dimension to humanitarian military relations. I wondered, though, if you are considering a holistic definition of gender. So, of course, men and boys will face particular concerns when they're dealing with an armed actor, quite different from those that women and girls face. And I wondered as well if you are looking at any other identity characteristics that might affect a person's relation or relationship with armed actors, such as sexual orientation, disability, or age. Thank you.
I'm happy to take this. Is this on? I feel like it's not on.
There you go.
I feel like it's on now. Okay. Anyway, the answer to your question is yes. We are interested in looking at gender in holistic terms, and I do agree that a wide array of identity characteristics, even beyond gender, are important to consider. I think about it in terms of there is some research that's been done on humanitarian negotiation about this, the role that gender and identity characteristics play into humanitarian negotiation. I have published an article on this, as a matter of fact. So I obviously think I do agree that it's important. But it is that that insight is applicable to humanitarian negotiation more broadly. That when humanitarian actors are negotiating or interacting with even actors beyond armed actors, different identity characteristics are going to play some role in shaping how that interaction proceeds. Nationality, religion, ethnicity, skin color, age, a wide range of factors. So yeah, that's all part of it, is making sure that all of those insights that are coming from that field are also being infused and integrated into how we think about humanitarian military relations specifically.
Yeah, and I would add the complexity of it is on a few different levels. I mean, you have the relationship between affected communities and both military and humanitarian actors in settings where military actors are committing acts of gender-based violence, and also in settings where humanitarian actors, especially like in DR Congo during the Ebola response, were known to have committed acts of sexual exploitation that were widely publicized. And then at the same time, you have the gender dynamics that come into play when humanitarian and military actors are coordinating with each other or attempting to coordinate with each other, given sort of the power structures inherent in most militaries as well as humanitarian organizations around the world. Let's see, first and then second. No, it was over here first.
Okay. Yeah.
Hi, I'm Melody Knight with the Norwegian Refugee Council. My question is thank you. In any of your research in the field, I wonder if you could explain to us the extent to which the quality of services provided led to more acceptance from the community. So if we're talking about putting crisis-affected communities at the center, we might assume that really high-quality services were more well accepted by the communities, and that possibly that transferred to a different perception of the armed actors involved in the distribution of the services. So I wonder if you could speak a bit to that. Thank you.
Thank you so much. So basically, it really makes a big difference, especially in the case of Rukban. I know that the basic needs services were accepted by the people, and whenever we had planned or we would plan for an evacuation or like a similar operation, the people would not accept the evacuation proposal. They would ask for immediate basic services, food assistance, hygiene kits, shelter, so things that they can live with every day. They didn't want to go back to Syria, to the government-controlled areas. However, when the UN set up the health clinic, it was used as a triage area, so it did not have all the services, and there were many challenges, especially for medical cases, such as the C-section operations for women who needed immediate transfer from the camp to the nearest hospital. So the establishment of this UN clinic was it was not the best solution. It was basically like a temporary solution, just to screen the medical cases and refer what needs further intervention to the Jordanian hospitals or other hospitals. But now the nearest clinic, I know that the UN clinic was closed with the start of the pandemic, but now there's a clinic inside the camp. It's inside the 55 zone, which is managed by the US forces. And they have services also that are basic. They don't deal with really urgent services. So the best they can do is now refer those who need medical intervention and treatment to the hospitals in Syria, and in some cases to the hospitals in Jordan. So you have people accepting what's being offered as basic, but not really that would sustain their presence or their well-being for the months or years to come. Thank you.
I wanted to add as well, I think from the Jordan context, one of the things that I found most interesting, looking at the affected community perspectives, and just to build on Zain's comments, was that a lot of community members sort of disassociated military and armed actors from the provision of other services. There's a really kind of more typical association of the Jordanian military in particular as primarily being there to provide a security function. And so there was a loss of criticism, as Zain referenced, or at least issues that were raised with the provision of other basic services, but those were not associated with military actors. So in that sense, I think that, the association of quality with a particular service provider was quite clear, but it was not attached to an association with the military and armed actors, even though they were essentially being tasked by the same government in some cases when it came to the provision of other services by the Jordanian state. It just as a sort of tack on to Zain's comments.
Thank you.
Okay, briefly.
Yeah, so in the Philippine context, what's interesting is that the uniformed personnel recognize that the civilians are quite threatened by their presence. So they developed a stronger community relations approach, and that allowed them to access the communities better and then work with communities in ensuring hazard reduction and disaster mitigation.
I think who's next, and then you, then you.
Thank you, Alexander. Good morning. I'm Sergio from the Chilean Naval War College. My question for Maria, you anticipated my question, was about prevention and how, maybe in two parts, as local population, first responders, and I express my solidarity with your nation coming from the other side of the Pacific fire ring. What are your findings or your comments on education of the local population, and also drills or this previous interaction between military, local population, and local disaster management agency prior of these high-frequency events of disasters?
Right. Wow. That's a loaded question. Since I've mentioned earlier in my presentation that the Philippine government has decided to better its approach to disaster management, and so with that, there were localized versions of a disaster risk reduction office. So when I say local versions, we're talking about village level versions of that. So they've tried educating community members on how to respond to hazards, and at the same time they have there is a program going on how to effectively relate with service providers, which include uniformed personnel. But the question is that program effective? So with the plans are all good, but given all the data that we've had so far, when Taal erupted and when COVID happened, it appeared that there is still a major gap in the coordination processes. So the community members understand what they're supposed to do, but because of the threat that they feel with uniformed men coming into their communities, that kind of made the application or implementation of their plans a bit difficult. Did I answer your question? All right.
Can I tack something on quickly? Is there
Sure.
I just think, just as a brief conceptual aside, I think a really interesting issue that comes up, and I hope maybe we have a chance to talk about at the workshop related to this, is that there are some pre-existing local disaster management associations in countries that are prone to those, but those don't exist in a lot of places, or they're not widely used. And we often talk in this workshop about the need to have pre-crisis civil engagement as one of the solutions to actors coming together and being able to operate effectively in response to crisis. But when you attach that to some of the other findings from this project, like localization and the need for community members to be more directly engaged, not just spoken to and educated, but actually operate and make decisions about the response in their areas, how pre-crisis civil engagement is going to work is really tricky. I mean, I don't know that we're necessarily suggesting that militaries, or maybe we are, that militaries have very localized liaisons and conversations in advance of crisis or not. But I think it's just important to remember as we have those two conversations and we look at those two different priorities to try and come up with creative solutions as to how those things can coexist.
In the back here first.
Thank you. So I want to pull on a kind of a thread that Rob mentioned in the overall recommendations about the need for greater connections to localization and decolonization ideas. So rightly or wrongly, as we know, humanitarian agencies often get associated with former colonial powers or current neo-colonial powers, which can impact their ability to sort of distribute services. And all of the 3 case studies that you all have mentioned, these communities have reasonable doubt to doubt outside communities, right? Like murder of Patrice Lumumba, the colonization of Iraq, the ongoing colonization of Palestine, benevolent assimilation, and U.S. troubling labor and economic relations with the Philippines. I'm curious if your interlocutors spoke to any of those dynamics, of some of those dynamics making it more difficult to trust humanitarian service providers, or if there was any difference in between the case studies that you noticed with people's sort of trust in humanitarian organizations. And I should have said this at the beginning, I'm Ari Talani with the Center for Civilians in Conflict, or CIVIC.
Yes, thank you.
So there, of course, they did not say it that way, but there is a greater suspicion, at least in the communities that participated, and those that I've worked with as well, that there's a greater suspicion of humanitarian workers. Like there's the idea that maybe either they're converting them to a particular religion, or that they just need something from them. So that's mostly the case. But I think at least in the communities I've worked with, and some of them participated in this project, the idea of having international humanitarian workers were more acceptable as opposed to having uniformed personnel, because of the long history of military issues in our country. So, Zane?
Yeah. So thank you for the question. For example, in Rukban, unfortunately, most of the people do not really trust what the UN is doing now, because they don't see any results being delivered, especially after the closure of borders or after the suspension of humanitarian operations. And so there's always a question whether the UN is playing the role, or if the role of the UN is relevant now. And that's why people would rather, again, refer to the local actors inside within the community to seek their support, even given that there are so many troubles and issues happening already on the ground. But they would rather interact with the local actors. And that's, in a way, what guides our work in terms of planning for a humanitarian operation or an evacuation. We always go through the local actors, through, of course, the relevant governments. Thank you.
So I think we'll need to take a few questions at once. So maybe you had a question in the back there, and then over here. And then we'll take those 3 questions. You guys maybe take some notes, and then you can respond to whichever is most appropriate. And please introduce yourself. Right here, Amy first.
Hi. Firstly, thank you very much. The presentations were fabulous, and it's a pleasure to be here. So I'm Amy Russell. I'm from the UK, and I work for the Ministry of Defence as part of their Centre of Defence Healthcare Engagement team. What I would like to know, listening to those talks, it was interesting to see the mixed results about opinions on military engagement. I'm only speaking on behalf of a formed government military rather than armed providers. Where do you now see the military contributing effectively to humanitarian and disaster response? And could we leverage a mill-to-mill relationship to gain better access for our civilian counterparts trying to get into a country?
Good morning. My name is Alain Stirone. I am a research fellow at a program of global surgery and social change at Harvard University. I have 2 questions. Based on the critics, locally and international, about Ebola response by local authorities and military corporations, so how do you think things could have been better handled? And my second question is how your study could and will benefit the community of DRC. Thank you.
Last, Catherine over there.
Hello, Catherine Kramer from Interaction. Thank you very much for the presentations. Perhaps mine is a bit more of a food for thought. But having engaged armed non-state actors for some 20 years to respect international humanitarian law and human rights law, I found it somewhat surprising that everybody seems shocked that non-state armed groups, or at least some of them, can actually provide a positive response in humanitarian crises. And so I would also like to then say with that like with governments, non-state armed groups like to know what's going on in their areas that they're operating in or control. And so, and then this also comes back to another question, because often humanitarian actors are so concerned with the issue of independence and neutrality if they're working in armed non-state actor areas. But I find it very surprising that they never question that on the government side of things. When the government, especially for international actors, control everything about where they can go work, how they work, visas, et cetera, and all this, and yet the question of independence is never questioned. And neutrality is also very often not questioned. And so I'd like to kind of throw that out there, at least for thought. I'm not sure if you can actually respond to that, but just a question of thought. Thanks.
All right, so I'll turn it over to our panelists to answer whichever of those they find most relevant.
Well, people are looking at me, so I feel like I should probably say something. Maybe I'll just say a couple comments about governments and non-state armed groups and how humanitarians perceive independence, neutrality, humanitarian principles. I can talk about it in terms of the Rukban context. From the interviews we conducted amongst humanitarians, the reason that it brought up a lot of concerns and debates among humanitarians about humanitarian principles and what types of compromises were acceptable to take in this context came from constraints imposed by the government and the Jordanian army, but also from non-state armed groups in Syria that were aligned with the Jordanian armed forces. But essentially, in order to evacuate people from Rukban who had acute medical needs to the UN Medical Center, there were a couple levels of triage that had to happen that humanitarians could not play a direct role in, or if they agreed to play a role in, could not necessarily control the process. One is sort of who from Rukban actually can get out to access the medical center, which seemed to be controlled to some extent by the tribal leadership in Rukban, which included non-state armed groups there. Zain will correct anything that I say that's not correct. But then it gets to the Jordanian armed forces, and there's a second level of triage involving the government and the armed forces there. So that brought up a lot of concerns about a lack of knowledge about, and actually a sort of near certainty that the whole population in Rukban in need of medical needs is not able to access the medical clinic, and therefore the process in place is not impartial, because the people with most urgent needs are not the ones able to access the clinic. Same with cross-border operations as well. It involved approval from the Jordanian armed forces, but then with the crane operations, for example, turning over the aid to tribal leaders that would then distribute it to the people, or implementing partners through cross-border operations who themselves were linked to the tribal army. And those are the issues. So at least in this context, there were concerns about the government, about neutrality and independence that came from the control that the government and the Jordanian military exerted on the process, but also the control that non-state armed actors also had in the process. It's not to say that I don't agree with your broader point. I do think that is a curious trend that one can observe, but at least in this context, that's what we saw from our interviews.
I can jump in and try and respond to the questions about DR Congo. I'm sorry, I didn't catch your name. What was your name again? Alens. I think they're really good questions. And I have a couple of thoughts about it, but it's something that is an open-ended conversation. I'd love also to speak with you, at lunch and as well, because I could talk for some time on this. But I think that one initial observation when the question is asked about how this could be better or could have been better, I think that something that I've seen in several contexts and something that came up in the data from, I think, all of the case studies to some extent, was that when there's a protracted conflict or significant insecurity, and all of these contexts to some extent are insecure areas affected by conflict, it becomes really very easy, becomes too easy for responding agencies to essentially excuse certain types of either mismanagement or certain ways that they might be able to improve the ongoing response by hand-waving insecurity as the justification or the reason that it's not possible to do better. And I think that happens quite a lot. I do think that what really could have been done better, and I know that this is a drum that I'll continue to bang, is that I do think that there was the possibility of localizing the response and involving many more local actors than occurred. I'm a perfect example of that. I'm from the US, living in the UK, and I was in DRC responding to that outbreak, and that kind of doesn't really make any sense. But I think that the other point related to that, which I think is important to consider in the wider group, is that when people talk about local, that's a big term, and it's not necessarily that well understood. I was interviewed a few weeks ago for a project looking to identify better response mechanisms for local responders, and I only got to the end of it and realized that they were talking about me, because I'm the person who's in the country trying to do something, and I thought that they were talking about the people that are actually facing the crisis, responding at that sort of village level or household level. And the point is that in a lot of the context that we're talking about, some of the interventions really are not that complicated. It's not just the tertiary care in a hospital. That requires some expertise. That's really tricky. But when you talk about surveillance or contact tracing, or you talk about the provision of goods and services and trying to get resources out to people, I mean, these are things that really could be conducted at much, much more local than a national actor. And someone from Kinshasa in a place like Congo is not readily accepted as much as I'm not readily accepted in a place like North Kivu. And it's only one example of something that could have been done better, but I do think it's a significant one. And I think asking that question of, what does it mean for something to be local, I think is a really big question that demands our attention over the next couple of days. Your second question, just briefly about, I think if I caught it correctly, was how does this study sort of benefit the communities of DRC that we're spoken with? And it's a great question. I mean, we hope, of course, that the findings from this research, which are still being developed over this summer, can be disseminated and around to different actors. To the extent that this is the case and it's limited, I'm sort of encouraged by the fact that there actually was another Ebola outbreak in North Kivu after the 2018 to 2020 outbreak. And whether it's from this research project or not, and I think a lot of it is organically learned by the different affected populations and also UN actors and other INGO actors in the area, there was a much smaller presence of military insecurity, and there was a much greater focus on using affected populations for things like contact tracing, surveillance, and so forth. And I think that those are really important lessons learned that this, at the very least, reinforces, and that can hopefully be carried forward in the future.
Sorry, Adam, just to go back to your question, Amy, thank you so much. Just also to reiterate what Sam had mentioned about training or maybe building relations with the military before crisis, it's part of the preparedness efforts. And we, in the Civil Military Coordination Service, we're also providing trainings on civil military coordination for a variety of audience, including civilians, including military actors. At a country level, I think going back to the importance of localization is to keep on working with the military and provide guidance on the humanitarian principles and work together all the time. I think that's a good entry point to achieving what we are looking for. We also want to enhance and to make sure that we incorporate the gender aspect in all of our work with the military. It's highly important. We have been through many struggles, and I think it's part of the topics, along with the protection and other topics that should be highlighted in our trainings.
Can I just ask, as part of the study, was there training in women, peace and security and humanitarian principles looked at when you looked at the militaries and providers?
Yeah, I mean, the thing is, unfortunately, in some countries, including Jordan, we keep on having restructuring amongst the military. So whenever there's a training being delivered, not everyone really continues the same effort. So it's really important to make sure that there's a plan for them to cascade this training to other officers that will take the hang on after the restructuring processes and whatsoever. So that's another challenge, but there's always a way forward, a recommendation.
Like I say, as part of Defence Global Health, both UK and US are doing this. And we're taking programs like military global health engagement and taking it to Jordan. I've just come back from teaching out in Jordan to the military out there on exactly this. So there are ways to engage mill to mill which may access and help them deliver better care and better response at the end.
Yes. Thank you.
Thank you for that. Thank you for all the questions from everyone, and thank you again to our panelists. We can give them a final round of applause. So I apologize we weren't able to get to everyone's question, though we do have to break for lunch now. However, please, if you have additional questions, feel free to email us. We also shared with all of you the 120-page report on which this presentation was based. It obviously includes a lot more information than we were able to cover today. And so if you have any comments or suggestions about anything in the report, we would also love to hear it, because we will be shaping that into published articles, and we would love to hear your thoughts and ideas before we do so. You can always email Alexandria, since all of you have her email, with any thoughts or comments on the report or the presentations today. So with that, let's break for the next hour, and we'll come back here at 1 o'clock for our next presentation. Thank you, everyone.
Thanks. I'm glad we had this time.
Yeah, right. Yeah, it actually.
I was totally wrong. I was worried about
All right, everyone, please take your seats, and we're going to get started with our second presentation of the day. So I am pleased to introduce our second presentation, Humanitarian Access, Great Power Conflict, and Large-Scale Combat Operations. I think you'll find this to be a very prescient presentation, which was designed long before the invasion of Ukraine, but has many, many parallels to what's going on right now. So hopefully we'll spark some great discussion. In terms of our speakers, we have Rob Grace again, who I introduced for the last panel. And then he's joined by Tarana Sable, who is a research assistant for the Center for Human Rights and Humanitarian Studies here at the Watson Institute for International and Public Affairs. She is studying history and political science at Brown University and has served as senior managing editor of the Brown Political Review. She's also previously interned with the U.S. State Department and Human Rights Watch. So we'll welcome them both for this presentation, and then afterwards we'll take Q&A just as with the prior one. Thank you.
Thanks very much, Adam. I'm going to just offer a few introductory comments about this project before turning it over to my colleague Tarana, who will describe the methodology we used and begin to present our findings. First, I just want to acknowledge the contribution to this project of our colleague Brittany Card, who was our co-author, our co-researcher. She co-conceived the project. We very much value the intellectual and creative collaboration that we had with her on this project. Second, a comment about the background of the project. As Adam said, we conceived of this project about 1.5 years ago, well before the events in Ukraine of the past month. The research participants with whom we engaged last year, well before these events as well. The events of the last month obviously put a new framing on how one might see what we articulate here and the findings that we discovered through this research project. And we actually anticipated when we first thought of this project that we might have to do some convincing when the report comes out that this topic is one that is worthy to focus on. We did not see it as a ripped from the news headline type of research project. But yes, there is contemporary relevance, but we also want to highlight that the relevance of this issue goes well beyond the events that we see in Ukraine and the possible implications flowing from that. There's something larger and broader that this report is responding to. Here's a quote from 2018 that frames some of our thinking. "We are in great power competition today, and with competition, conflict is always a risk. This is not just a problem for tomorrow's leaders." This is an articulation of a military viewpoint. Militaries are preparing for large-scale conflict with one another. The US, China, Russia. Our notion, our impetus for starting this research project is that it is important for humanitarians to scale up their resourcing and their thinking about these issues as well. A third and final introductory comment. When we examined these issues, we kept the scenario loose, and this is how we did it when we were engaging with the research participants as well. We did not articulate a specific fictional future scenario and ask our research participants to respond to that. We more broadly were prompting our research participants to tell us how they might imagine large-scale combat operations in the context of great power conflict. At the heart of this analysis, in terms of the types of response contexts that they were envisioning, are large-scale combat operations, meaning major military operations and campaigns aimed at defeating an enemy's armed forces and military capabilities in support of national objectives. So the notion is that this type of conflict head-to-head, peer or near-peer military confrontation between two states is potentially very different in nature and will potentially lead to a very different access environment than the access environments that we have seen in the past 20 or so years, which have been largely predominated by internal conflicts, very fragmented operational environments involving a combination of governments and non-state armed groups. Okay, I will turn it over to my colleague Tarana, and she will say a bit more about the methodology that we used for this project.
Okay, so an overview of the methodology for this project. We started with a desk review, which involved analyzing literature on pertinent subjects, including humanitarian access and contemporary and historical understandings of great power conflict and the status of current trainings and preparations for future great power conflict and large-scale combat operations. These were broad overviews of the subject, but also aimed at purposefully gleaning the insights of Chinese and Russian scholars and perspectives, given the relevance of China and Russia to this subject. From there, we moved to virtual focus groups in May and August of 2021. Session 1 and Session 2 had 11 and 10 participants respectively, and Session 3 had 12. We thank Jonathan Robinson, Hank Brightman, and Dave Pilati for helping us to convene the first two focus groups, and we thank Beth Eggleston and the Humanitarian Advisory Group for helping us to convene the third. And these focus groups involved government, military, academic, and humanitarian stakeholders with diverse perspectives on the subject. From there, we moved to semi-structured interviews in the summer of 2021 with 5 key informants. All of these interviews and focus groups were held under Chatham House rules, meaning that no identifiable information about any of the research participants were made available in conjunction with our report, including any organizational affiliation and names. And once we finished with the focus groups and semi-structured interviews, we used the qualitative data analysis software NVivo to inductively analyze the transcripts and draw out key themes. The total number of research participants was 37 across the focus groups and structured interviews. So how did research participants envision possible future large-scale combat operations? We selected this quote as being particularly emblematic of attitudes that people had, which is mostly that large-scale combat operations within the context of great power conflict have no precedent in recent history. This quote says, "I personally think that the conflict will look nothing like recent conflicts of the last 20, 30, 40 years in terms of the scope and scale of violence. The unbounded nature of it is something that governments, populations, and militaries will find difficult to stop. There's a lot of planning going on at the moment, but in terms of how it compares to recent conflicts, no comparison at all." So what are the particular conflict characteristics that research participants were envisioning? One common theme was that participants imagined large-scale combat operations in the context of great power conflict to be global, unbounded, and metastatic, spreading out across a vast expanse of geographies and also playing out across multiple domains: air, land, sea, space, and even cyberspace. Participants also imagined a dynamic conflict that would involve both military-to-military conflict and proxy warfare simultaneously. Participants also imagined a scenario of total war that was incredibly fast-paced, lethal, and destructive, and would also involve high levels of civilian harm, sometimes intentional and strategic, but not always the case. Participants also imagined that cyber and information operations will take an increasingly central role in great power conflict and in large-scale combat operations, which means that cyber attacks, misinformation, disinformation, and malinformation will all become central to the way that war is waged and the way that conflict plays out. And I will turn it back over to Rob.
Okay, so given the perception of the possibility of this type of conflict, I'll just lay out some findings from us, drawing largely from the inputs from the research participants about what the access environment is likely to look like and what challenges humanitarian responders are likely to see. We divided access challenges into 3 different categories: political challenges, operational challenges, and technical challenges. I'll start with political challenges relating to high-level political or strategic engagements, often involving issues related to the norms or values that undergird humanitarian action. There are 3 big challenges to highlight here. The first is the likely limited impact of high-level multilateral political engagements. There was a sense that in this type of context, probably no surprise, the UN Security Council is unlikely to be a very useful forum for conflict resolution measures, or perhaps even to push a humanitarian agenda. I don't think that we can emphasize enough the extent to which research participants very strongly expressed that a conflict of this nature could very well be a make or break type of scenario for the UN system as a whole, including the UN system and the international humanitarian system as a whole. The second point is politicized government perceptions of international humanitarian actors. If we're talking about a conflict between Western countries, Russia, China, we're going to likely see humanitarian organizations struggle to operate on all sides of the conflict. From the standpoint of the West, you're going to likely see skepticism about Russian humanitarian efforts and Chinese humanitarian efforts. If you're Russia or China, you're likely to have some skepticism about humanitarian efforts that are arising from Western countries, bringing some challenges to the way that the international system as it exists today can actually operate in a way that's in line with humanitarian principles. We're anticipating a fragmented operational context. And third, there was discussion about relation deficits with potential state actors. And here research participants were really talking about the state of relationships and relationship building between international humanitarian organizations and China and Russia, including the government, but also humanitarian actors in both of those countries. Shifting to operational challenges relating to developing and planning practical and procedural methods or for activities or operations that align with broader political and strategic goals. So this is the mid-level line of challenges, a few to highlight here. One is a widespread expectation that there will be a high level of bureaucratic impediments and donor restrictions flowing from the reasons that I already mentioned. Humanitarians are expecting that in such a context, they will struggle to get access to countries. They will struggle with administrative procedures and devising a system that will swiftly allow them to operate from a bureaucratic standpoint, as well as donor restrictions, including counterterrorism issues, if we're talking about proxy warfare, non-state armed groups, but also sanctions affecting engagements with states. There was discussion about the likely limited operational role of traditional international humanitarian actors because of all the issues I mentioned, bureaucratic obstructions, but also the challenges mentioned at the political level. There's a perception that the large international humanitarian players will likely struggle to gain access, and that what the implication is that local responders will play a very important role. So there was discussion about the sense that success in humanitarian access in a response context like this is very much linked to issues of embracing the localization agenda, also connecting to the discussion we had in this morning's session. Point 3, there was discussion about devising processes to manage humanitarian insecurity. A discussion about humanitarian notification systems. Can they be implemented effectively in such a scenario? Will states agree to use such systems? Will humanitarian organizations be able to use such systems? And given the likelihood that there will be cyber issues, cyber attacks that could target communication systems and electrical grids, will the technical capacity actually be there to share information between humanitarians and militaries? Third and final category is tactical challenges relating to implementing operational arrangements while also responding to ground level issues, which can change rapidly. 2 points to highlight here. One is managing access and logistics across multiple domains with limited resources. As Tarana said, there's an expectation that this type of conflict will span all warfighting domains, air, land, sea, space, cyber. It presents a big logistical challenge, especially given the expectation that logistical capacity overall is likely to be sucked up by the warfighting effort. So the question is, if these, transportation capacity, even hospitals are being used as part of the war and the military effort, to what resources can humanitarian organizations turn? And finally, physical and digital threats to aid worker security. There's an expectation that such a conflict is likely to be a highly volatile and insecure environment for humanitarian organizations to operate in, and a lot of concern about digital threats, a lot of concern about the cyber realm that comes from a variety of sources. One is misinformation, disinformation, malinformation, how the information environment will shape how humanitarian organizations are perceived, but also how they can accurately assess the environment themselves. As I mentioned also, potential cyber attacks that affect the technical ability to communicate with one another or rely on the resources to which humanitarian organizations are accustomed, electrical grids, communication platforms, as well as cyber attacks on civilian infrastructure that the attacks themselves will be a driver of humanitarian needs. So that's the access environment. Essentially, an extremely challenging access environment at all three levels, if not the most extreme cacophony of access challenges that one could imagine. And in many ways, some of these issues are not new. We see these issues already playing out in many ways. But to have them all together and amplified in such an intense form is really what we're talking about when we're talking about an access environment in large-scale combat operations in the context of great power conflict. A few recommendations that flow from our analysis and that flowed from our engagement with the wide array of research participants that we engaged with in this process. One is to develop awareness in the humanitarian community about possible future scenarios, including humanitarian implications and response requirements. Here's where we see very important to push forward the thinking in this report, which, as I mentioned, was very loose in terms of the scenario. It was very much research participants themselves bringing forth their own perspectives about, what types of scenarios are most likely. But we see the importance of continuing to push forward this thinking and analysis and orienting planning around more specific contingency planning and scenario planning for the future. There are some initiatives out there that are already doing this from a humanitarian perspective. These efforts have been very much appreciated by the research participants. There's a sense that we need more. There's a sense that militaries are devoting a great deal of resources into military planning, and that humanitarians need to scale up to, in some way, more approximately match that level of of forward-looking thinking. Second, incorporate humanitarian and protection of civilian considerations into military planning. Obviously, there are efforts to do this as well, but this type of response context illuminates the importance of that issue. 3, build relationships with potential future parties to the conflict. And here again, this comes from the research participants' discussions about the dearth of relationship building efforts that they see between the traditional international humanitarian responders and actors in China and Russia. Of course, not true across the board. There are organizations that are building such relationships, but again, it's a matter of scaling up these efforts. 4th, conduct planning to ensure the continuity of humanitarian operations. So this gets to the possibility of power outages, of loss of communications, and how can humanitarians operate, how can they coordinate with one another in the absence of those technological resources. This could entail making sure that people are trained on map reading and use of radio communication or whatever they will need to continue to operate in the absence of that technical capacity, should there be attacks, whether military attacks or cyber attacks that deprive them of those resources. And there are other issues as well, such as investing in cybersecurity, given the likelihood of cyber attacks in this context. And finally, improve humanitarian military relations through education and training. Again, I don't think I have to convince you about this 5th one. This is why we're all here, but just to highlight the importance of this, the importance of events such as this one that we're convening this week, and the importance of continuing and sustaining these discussions and this dialogue, making sure that there's a forward-looking perspective that is taking very seriously the true risk of large-scale combat operations erupting in the context of great power conflict, and the importance of preparing for those types of response environments. I will leave it there. That is our assessment of humanitarian access during great power conflict. We very much look forward to your comments and inputs. I have said questions and comments, just to highlight that, in some academic conferences, they say, make sure your contribution ends with a question mark. I don't feel that way here. We intended this report to be a conversation starter or a signal booster to conversations that are already going on, and we hope that in this room, with the remainder of our time here, we can continue that conversation with all of you. Thank you.
Wonderful. So we're going to open it up now to questions for Tarana and for Rob. And just as before, please raise your hand and we'll bring the mic to you. I will also point out that their full 40-page report is now available on our website. If you go to our CHRHS website and you click on research and then on publications, it's the first one there. So there's a whole lot more in the report that they couldn't discuss today because of time, and I hope you guys will read it and give us your comments on that as well. So let's open it up to questions. Oh, right here.
Hi, that was a great presentation. Thank you very much. My name is Craig McLean. I'm with the program Global Surgery and Social Change at Harvard. And one of the things that we're very involved with is trying to help LMICs build sustainable surgical systems. And we've done a lot of work in this space talking about the benefit of a robust surgical care system in helping with things like the pandemic, as an example of a crisis. And so as I'm thinking about this, I'm wondering, how do you think that we, as sort of on the civilian side of things, can partner with the military to help advocate for building these systems that may actually help with significant healthcare needs of a civilian population in such a issue as this, as major conflict? recognizing that a lot of, civil society is going to be completely disrupted by this. But I think that if you have a system in place, there's probably a lot of benefit that could come from that rather than these, folks that don't have any robust healthcare systems in place. Anyway, thank you very much.
Yeah, thanks for the question. I agree that that is extremely important. In terms of the answer to the question of how can civilians advocate with militaries on this issue and similar issues, I suspect there are others in the room that are actually better poised to answer that question. So I'll sort of play the role of moderator and just sort of put it back to the audience and say, people with comments on that, please feel free to weigh in. But it's a very important question, the role that that civilians can play in terms of building systems that can be operable in such a conflict. But I welcome comments from others, whoever might have them. That's my non-answer answer.
Yeah, absolutely. We can take comments as well as questions from folks too. And I'll add to that I think in the setting of great power conflict, one of the key questions will be the differentiation between military and civilian healthcare and especially trauma care response systems. To what degree does a attack on the mainland here in the United States, for instance, necessitate sort of the use of military for civilian healthcare in addition to the civilian healthcare in operation, and you could definitely play that out in Europe as well and many other places. But let's hear, I think, first from Amy, and then we'll go over to Joanna next.
Thank you. Just to comment on that one, the research project from Harvard on the low middle income countries and trauma systems, engaging with the military and their research people is incredibly important from an academic point of view. So we've been involved, the UK military and the US military were involved in that project from the start, and we're looking at involving both LMIC country militaries and their civilian counterparts as well. So it's looking at the audience of the research project that you're undertaking and who you can get to be partners with. Just a quick one for your comment. Did anyone talk about CBRN environments? It's a niche piece for military personnel, and it's currently a really hot threat. How would that impact on the humanitarian aspect? Sorry.
That's fine. I was just trying to think about it. I don't think there was much discussion about it, actually. It might have come up in a sort of more of a tertiary way in terms of the more broader concern about humanitarian insecurity and how to manage humanitarian insecurity in a context like this. There was discussion about landmines and how that's going to lead to a long-term security threat. But strangely, perhaps, I don't seem to recall from the interview data that came up as a central point of discussion. That's not to say that it's not an important issue to talk about. It, of course, is. It just happened to not play a central role in the conversations that we had with our research participants.
Joanna next.
Hi, Joanna Fonamava I'm a fellow at the Center for European Policy Analysis in DC. My question is kind of related to the discussion we were having this morning. So in this context, how does that change the dynamic of the civ-mil relationship when you've got two active militaries fighting, but then you've also got humanitarian access challenges? How did you have discussions or any thoughts on what that dynamic then looks like in this specific context of conflict?
Yeah, I mean, one of the topics of discussion that came up is the possibility of essentially a full-scale population mobilization. So essentially a complete blurring of the lines between civilians and militaries, both in terms of responders, but also who the affected population is. There was discussion about the possibility of large-scale, conscription. You see that in Ukraine. Obviously with adult males. But so yeah, I mean, that is a conflict that is seen in terms of humanitarian principles. What does that mean for humanitarians trying to operate in a principled way, and what it could even mean, whether principled humanitarian action is even possible in any form in this type of environment, but also on the logistical side as well. Who are the civilian responders going to be? Who are the humanitarian responders going to be if we have populations and resources that are being really, in a real whole-scale way, directed toward the warfighting effort? I think those are two ways that that challenge came up in the discussions that we had. Yeah.
Particularly where you have civilians joining, so you have the territorial, where you have the territorial defense kind of being made up of civilians, but then you're also seeing, I'm going to use Ukraine as an example because I was just there, but for instance, if you're having to see these same military actors provide protection in a humanitarian sense, because there is no way of protecting these people, you're also then essentially having civilians and humanitarian access in terms of the second part of in your paper you provide the two definitions of access through humanitarians actually getting there and humanitarian access in terms of the civilian population having access to water, food, and the basic necessities. So if you're having to see the military be the only people who can provide that second part of the humanitarian access, then you don't really have the ability to have some of those, the humanitarian principles exist. So I don't know if you've got thoughts on that?
I mean, I totally agree. I think it's a complete challenge for a principled humanitarian
Do you
action.
think we're prepared for it in any way, mean, or form?
I do not. Feel free to disagree with me, somebody, but I do not.
I think we had a question in the back, and then we'll go to Rob Waters next.
Hey, Rob. Jay Kurtzer from the Center for Strategic and International Studies in Washington. And Tiana, thanks for that presentation. I'm thinking about your recommendations when you're talking about the scenarios, but also in terms of local responders. Can I just yell? Does that work? There's a problem set that I think where we kind of know what we need to do, but no one's willing to put the resources towards it. I've had multiple conversations over the last 6 months because we've had two highly predictable humanitarian emergencies that there was really no planning for in advance, right? And the first one was Afghanistan. The United States announced what it was going to do, carried it through, then it happened, and then we had a massive humanitarian emergency. And when you talk to both humanitarian donors and partners in advance, they were not prepared for the large-scale emergency that erupted. And then you had 100,000 troops on the border between Russia and Ukraine, and then they invaded. And you talk to the donors beforehand, they were not prepared. I mean, they'll tell you they were prepared, and they'll tell you they did the contingency planning, but it's just not, it doesn't really, the evidence doesn't strike me as showing that there was a lot of contingency planning and preparation. Part of the problem is that the humanitarian community is substantially underfunded, right? So there isn't the resources to bear to do preparatory work, right? They're going to be coming from somewhere else. And so I'm curious in your consultations if people spoke to the resources for the contingency planning, and on the localization piece, the idea that the first responders are going to be the local civil society organizations. The way that localization happens now does not create a positive environment for them to play that role, right? It's like programmatic partnerships as opposed to funding them to grow and exist. No one's going to fund Chinese civil society organizations in advance of a great power competition. So we can talk about the proxy wars, the neighboring places where that happens, but what we know needs to happen is not what's being resourced to happen now. And I'm curious if that question of resourcing this contingency planning or changing the way we do localization was at all brought up in your consultations, or something that you're thinking about now?
On the first question about resources, yes, it was. This is a broader issue, of course. It's not just for looking at great power conflict, but it's about the extent to which humanitarian organizations are resourced and have the capacity and the space to engage in forward-thinking scenario planning and thinking. Came up in the Rook Bond context as well. just to sort of bring it back to this morning's conversation, but when the Jordanian government closed the border, I mean, this comes from what interview respondents reported to me, there was very little planning about different types of scenarios and just a broad assumption that the border will likely open up again and then we can get back in there. That's not how it played out. And there's a perspective that they lost time because they did not engage in this form of contingency planning in a more robust way. So yeah, I mean, you highlighted two very high-profile examples where there was forward knowledge. There was, knowledge that something big was going to happen in Afghanistan and Ukraine. But it points to the broader question of how humanitarian organizations can actually do that, given that they're underfunded, given that they're overstretched. How can they actually take a step back and devote time and resources to planning, in this case, for a type of response context that might not come until far in the future. But I think it's possible. Maybe I'm optimistic. But people did discuss it. There was one interview participant who said, hey, if we got backing and funding from some government or foundation to truly devote resources to examining and preparing for this issue, we would do it if given the funding. So it's a matter of funding. It's a matter of funding priorities. In terms of localization, you raised an interesting point. I don't think the discussion from research participants delved, deeply into how to address that problem, but certainly, absolutely, the challenge you highlighted about localization is the key issue, that the way that response is set up now will not operate in an effective way in this type of context.
All right, I think we'll take a few questions / comments at the same time. And Jules, and then over here as well. And Ron Waters. Okay, so let's take those two at least.
Great, thanks. Thank you. I think you're almost answering the question that even if these problems are foreseen, doesn't mean that anyone will do anything about it until they have to. And so from a group like this, my focus would be on just building capacity. That's the best thing that you can do, so that when the time comes that you require assets, they will be there. But if you tailor it too closely to a specific scenario or need, then it is likely that it would not fit whatever you need. Also, the military, my perspective, you could say that they've learned a lot of lessons that are very tailored to the scenarios they've been in. So that they found, for example, you rush out the hospital ship. Well, we didn't need the hospital ship because we had everything elegant, smooth, efficient. We could get people injured into Germany in a couple of hours. In the kind of conflict and scenario that you're talking about now, it would be awful, messy, and maybe nobody moves. And so who knows? So I would be advocating for capacity, simply capacity. And we haven't looked at it that way in a long, long time. We've gotten overly efficient and probably won't fit the scenario that you're talking about.
I'm Jules Frost, and I was reflecting as someone was asking the question and what you were presenting back to the Iraq War and what the humanitarian community had as far as capabilities in the region. And at the time, I was based out of Washington working with the humanitarian organization, and we knew that the humanitarian community writ large was not going to be prepared if indeed we had a huge influx of or outpouring of refugees from Iraq. There was some planning between some humanitarians and military at the time, which that was foreseen as really a no-no and somewhat naughty because of independence and impartiality and the U.S. potentially being seen as a belligerent? And also, where do you get money if you want to have independence and not be aligned with one of the powers? Well, a few NGOs decided we would go to government and ask for preparedness monies to get positioned in Jordan. And it was hard and it was difficult, and I'm surprised I didn't get fired during that process because of impartiality and independence. So how do we do planning and preparedness between the humanitarian and military community and uphold our principles when we can see things are coming? And I think that's really challenging. And so if we think about Ukraine as a, where and how did we look? Ukraine again. I was in a conversation last week where people said, have we thrown out the concept of localization? The international humanitarian organizations are all setting up operations where they haven't been. And I said, well, we can't forget what we've talked about. Local is possible, but as international as necessary. And as somebody was saying, the local capabilities with conscription and all the pressures, there's a need for regional and international support in some of these places. So how do we prepare and balance for those things? Not really a question, but a reflection on what you were saying. Thanks.
Thank you, guys. Any final thoughts?
I'll just say a couple final thoughts about those comments on the issue of building capacity and funding and resourcing, scenario planning. I think there are probably a couple ways to look at it. One is there are structural constraints that, Jake mentioned, lack of funding, lack of resources. And it's sort of a question of what can be done within those structural constraints. And the second question is what can be done to try to push back on and affect those structural constraints. That's, maybe one way to sort of parse out that question. The question that Jules asked about how can humanitarian organizations prepare with militaries while maintaining their independence and neutrality. It's not for me to answer this question. It's for us to live with and suffer with and try to work through as we all push forward together. Maybe I'll just leave it at that.
All right, let us thank our panelists. I'll invite them to return to their seats, and if we can have Lieutenant Colonel Shanks come up. So pleased to present the next presentation titled Rising Tide, Humanitarian Action in the Age of Climate Change. We're joined today for this presentation by Lieutenant Colonel Shanks, who is a visiting scholar and National Defense Fellow at the Watson Institute for International Public Affairs. He previously served as the provost of the U.S. Air Force's Air Mobility Training Center and as commander of the 97th Training Squadron. In 2014, he graduated from the Air Force's Elite Joint Mobility Fellow Program, where he authored groundbreaking research into the future use of unmanned and autonomous airlift systems. He currently researches the Department of Defense's role in global climate change and its response to climate security threats. Thank you.
Brilliant. Thank you, Dr. Levine, for that humbling introduction. And thank you all for being here and allowing me to be a part of this. You'll find my research is a little bit different, primarily, and we'll talk about the specifics here in a little bit, but it's created and packaged that I'm going to deliver to the United States Air Force and the Department of Defense. So you'll find it's a little bit of a different format, and you'll notice parts of it are kind of written in crayon in the coloring book, but all of this is intended to kind of be a product for the United States Air Force and the Department of Defense. And my intent today is to be able to talk about this. I'm really excited to be able to address this group of experts and very, very smart people in the room today and over the next couple of days. So as Dr. Levine said, I'm TJ Shanks. My military call sign is Doc. For a room filled with a whole bunch of actual doctors, it's a little more awkward. So please feel free to call me TJ or just throw something at my head. So again, I am a lieutenant colonel, active duty Air Force officer. I'm a C-17 pilot by trade, hence all of the crayon. But I'm really excited to talk about this topic with you all today. Of course, you know, as an active duty military officer, I have to precede everything with a disclaimer that I am not here as a representative of the United States government or the United States Air Force or the United States Department of Defense. It's just little old me, TJ Shanks. So if you are going to attribute, please let me know, and I will do my best to avoid lawsuits. Speaking of lawsuits, the second disclaimer I'd like to add is that this research, my research over the last year, and what we'll present today and I'll offer to you today is really based upon the scientific principle that climate change is a real thing, and that the fairly universal scientific consensus that human activity is a major player in the rapid advance of global climate change. So, of course, those conversations, particularly in an academic setting, are always welcome. But this discussion is not really intended to be that discussion. I'm happy to have that afterwards and bring in some much smarter climate science folks than I to discuss that. But this research and my presentation today is really based on those two primary principles. And again, we've kind of seen this, and we'll discuss this here in a little bit, that climate change writ large has become a very political, very divisive issue, which is kind of mind-boggling to me for someone who's been staring at the data for the last year and for the last several years, as it were. So with that, just a very quick overview of what my research is. Like I said, my research is intended to be delivered to the Department of Defense, but for the sake of the discussion today, obviously we'd like to focus the discussion on kind of the humanitarian aspects of global climate change and the convergence of national security considerations and climate change writ large. So my research is going to focus on these four main areas. The initial area being the DoD's contribution to global climate change, which needless to say has been significant. The U.S. Department of Defense is the largest institutional emitter of carbon emissions in the world, and particularly consistent operations over the last 20 years has played a major factor in that. So going forward, this research will be very interesting to see how theoretically the decline in some operations in parts of the world will affect that footprint. Global climate change's effect on national security, and this is something we'll talk about this very briefly in just a moment. You know, how climate change issues directly and indirectly impact U.S. national security and, frankly, international stability and international security. The mitigation of the effects of global climate change, which, frankly, has been a very, very big focus from the DoD's perspective for quite a while now. Now that we've recognized the reality of climate change, how is the United States Department of Defense and its allied partners around the world going to meet the effects of climate change in terms of resilience? And then, of course, this bottom one, my assignment after this is going to be the Pentagon. So if anything is going to get me kicked out of the building when I show up, it's going to be that bottom one. It's the advocacy for future carbon neutral systems in terms of sustainability and eliminating some of those, especially fossil fuel-based threats to operations around the world. And again, that comes paired with a whole series of recommendations I'll be providing to the DoD. Some of them will be very welcome, some of them probably not, in terms of how do we not just mitigate the effects of climate change and how do we build up walls and literal sea walls in some cases, and how do we do better at not being an active contributor to this national security threat ourselves. So I promise I will not make this a history lesson, but I'm a history nerd, so I can't help it. I just want to discuss a little bit about the history of climate security and viewed specifically through the lens of the U.S. Department of Defense. I know there are a lot of other nations, other governments that are doing a great job getting after this as well. For those of you who are familiar with climate security, you probably won't be too surprised to see Roger Revelle, Hans Suess. Their independent research in the 50s, Roger Revelle as a climatologist, Hans Suess as a physicist, both did a lot of groundbreaking research in the 1950s with regard specifically to climate change. Now, of course, climate change science has deep roots, really all the way back to the 19th century, in terms of equating greenhouse gases and carbon emissions to the effect on the planet. But it was really not until 1957, the joint research of Revelle and Suess, that really garnered the attention of the defense industry, of the national security enterprise, And their research, surprisingly, was partially DoD funded, primarily by our partners in the United States Navy, that looked into what exactly were some of the root causes of global climate change and what effect it may have on national security implications. So several conclusions that they came to in their research is what really kind of shook up the national security enterprise. Primarily that CO2 was a primary greenhouse gas that was leading to the greenhouse effect and global climate change. And they also reached a conclusion that human activity was a key player in those carbon emissions. And they went on to kind of begin to explain some of the national security implications, again, focused primarily on our naval fleets, their surface and submarine operations, how that would affect, and of course, specifically looking at a lot of the hydrological effects. It really wasn't until another couple of decades when we really saw significant DoD research in terms of climate security. Our very own Naval War College, which I understand we have quite a bit of representation here with that. Terry Kelly's paper out of the Naval War College in 1990 was probably one of the most striking correlations of that confluence of national security concerns and global climate change. Terry Kelly did a very, very nice job. I highly recommend you go check it out if you're at all interested. Does a very nice job at very articulately spelling out very specific cause and effects of climate change and national security concerns. Moving on to about 1991, we see the first substantive inclusion of climate change and kind of viewed through the lens more of environmentalism in the US national security strategy. Surprisingly, President George H.W. Bush, that startles a lot of people when they see that. Again, a lot of governments had already been working on this at this time, but this is really the first substantive mention in the national security world within the United States. For those of you who aren't familiar of the national security strategy, each presidential administration puts out one or two of these strategies. It's a very short 6 to 20 page document that's distributed to all of the government agencies to kind of give them a scale and scope of what the priorities of that particular administration are when it comes to national security concerns. So that document gets sent out, especially to the DoD, upon which they found kind of all of their other strategies, plans, operations, et cetera. And that national security strategy, the mentions of climate change have been included in every single subsequent national security strategy, with the exception of President Trump, very recently, and then was resurrected again with President Biden. Unfortunately, about 1997, we start to see the increased politicization of climate change as a topic. It really starts to emerge more and more within political discussions. In 1997, we see a surprisingly bipartisan resolution, a non-binding resolution, essentially tying the hands of President Clinton at the time going into the Kyoto Protocols, essentially saying before the United States can be entered into any climate-based agreement at the UN, every other developed nation in the world has to also agree to the same conditions. So it was very, very challenging, essentially shackling the ability of the presidential administration to get a lot done during those Kyoto Protocols. 2003, we really start to see an influx of increased military academic writing and research going into climate security. The Air Force's Air War College, of course, the Naval War College continuing their work on this, and then the National Defense University down in Washington, D.C. And of course, all of those paired with a lot of academic institutions around the country as well. And then 2015, we see a very, very substantive inclusion for the first time in our national security strategy with President Obama's administration, a full chapter. Now remember, again, this is only about a 6 to 12 page document, a full chapter dedicated specifically to climate security and global climate change as a national security threat. So this was a very clear indicator to the national defense enterprise that this was a priority. So for the sake of my research, we've really, again, for any climate scientists in the room, I absolutely apologize. I've definitely kind of made this as digestible as possible as I can. So obviously the effects of global climate change are very, very nuanced. It's an intricate web of balances. But there are really these four main categories from a national security perspective that draw concern. Obviously the increases in global air and sea temperature, global average sea levels, and then average global ocean salinity or acidification, depending on your perspective. Beginning with global surface temperature, I'm a visual learner, as you will see, so I've struggled to be able to depict this visually. And the folks at NASA, the Goddard Research Labs have done a great job. If you haven't seen this already, so you can see this is an average surface temperature depiction from 1880 to 2021. And you can see kind of the points going around in a circle, going month to month from year to year. That 0 degrees Celsius, that standard upon which we're kind of judging the advance of climate change, is an average between the 1950 and 1980 global average land temperatures, which the scientific community has kind of accepted as a standard norm upon which to kind of make the rest of our observations. So you can see around this 1950 perspective, we start to see it spend a lot of time around that 0 degree null. And as it progresses onward towards 1980, you'll start to see a fairly significant increase in terms of the global average temperature. And they've color-coded it for us. They knew I was going to use this. And then you can see as it expands into the 21st century, it gets farther and farther out at a higher and higher rate. And bless their hearts, they even did everything they absolutely could to literally turn this data on its head. And so now you can see it from a third dimension, and now you can see from 1880 all the way through current day the average global surface temperatures and the significant increase in very concerning data that you can visually see. We talk about global average sea temperature. Again, for an airplane pilot, talking about this in joules. It took me a little while to kind of work through this, but obviously a measure of energy in terms of temperature. And this chart only goes back to about 1957, bringing it up through 2020. But again, you can see a very clear indicator of global average sea temperature rise. Again, translating it for the pilot types, bringing it into my comfort zone of degrees Fahrenheit. I'm sorry for all of our European partners out here. But again, you can see this brings it back from 1880 all the way through 2020. The EPA was a source for this, and they did a very nice job at indicating precisely, obviously precision measurement of global sea temperatures was not exactly within the purview and capabilities of those in 1880. So you can see there's actually a variability. There's an anomaly accounted for there. But even accounting for that anomaly, again, you can see a very clear and consistent rise in global average sea temperatures. Moving on to sea level changes. Again, this has had a lot of discussion over the last year. This, again, provided by our teammates at NASA. You can see that chart on the right is the average sea level rise from 1992 all the way until present day. And again, for my compatriots, my military strategic planners who don't have scientific backgrounds, they look at this chart. I show them this chart, which I think is very impressive. But they look at the side and they say, well, that's millimeters. Come on. Come on, man, it's millimeters. But again, one, you can see a very significant and noticeable rise from even just a few decades back all the way up until today. Even if you look at, you can see that stereodynamic line down there at the very bottom, the most conservative, still very, very concerning. But especially when you consider that chart on the left that indicates that this is an average global sea level difference. So it's not going to affect every portion on the globe consistently and the same way. So when we're looking at, 80 millimeters of sea level change, that is an average. So you're going to see portions of the globe that are significantly above that, portions of the globe that are significantly below that. And you'll see in here just a moment that causes concern for quite a few different areas. And then, of course, jet stream migration. So as if we have any meteorological hobbyists in the room, the jet stream does migrate. It changes from year to year. It changes from season to season. That's part of some of our global meteorological dynamics. However, anyone who does have any background in meteorology knows the jet stream plays a very, very key consistent role in global weather patterns, in global rainfall, in global droughts. And what we're seeing over the last 5 decades is not just increased movement of the jet stream. We're starting to see it move further north to higher extremes, further south to higher extremes, and they're making those variations at a much higher rate than we've ever seen in recorded history before. Packaging that all up into the national security piece, The U.S. Department of Defense has done a really great job at, again, visualizing this for us visual learners. The U.S. Department of Defense just last year published a DoD climate risk analysis. This is open source. Anyone is welcome to see this. It's a very well-written report, very well-researched. And you can see in this graphic, they've actually broken down not just climate security threats that you can see listed up on the top. You can also see what the U.S. Department of Defense anticipates as a global threat or concern as a result of those effects of U.S. climate change, of global climate change, excuse me. So you can see it's broken down by each U.S. global geographic combatant command, we call it. It's just an area of responsibility around the world. But I'm happy to say I didn't know going into this research that there would have been quite so much attention paid by the Department of Defense. And I'm very happy to say in the last 6 to 8 months, there's been significant increases in efforts in terms of addressing the national security concerns of global climate change. So these are the 4 primary concerns that we, as the Department of Defense, and I, TJ Shanks, really assess as primary concerns as a result of climate change. So you can see these 4, the sea land installation risk. What is the risk posed by the effects of climate change to physical, like installations and bases and resources around the world? Arctic ice melt, which I think we'll talk about here again in just a little bit in a lot of these discussions. The rapid, the increased accessibility of the Arctic has really been causing a very significant concern. There's a whole new theater of operations opening up, and by, frankly, a lot of American competitors around the world. There's no secret that Russia has been militarizing the Arctic at a fairly alarming rate. But for the sake of the discussion today, I'll really focus primarily on these 2, disaster and humanitarian response, and the resource scarcity and instability piece. It's very clear that disasters, humanitarian response are going to increase. And I'm actually really glad that we had the opportunity to see the other presenters, although Rob is a tough act to follow, to be able to see those other conflicts and other concerns, because everything we've already talked about and everything we will talk about today and the rest of the week are all going to have to operate within this environment. So a lot of my military planners like to tell me, well, I've got more important things to think about than climate change. And I thought, well, that's great. My response to them is, you're going to have to do whatever you're thinking about under this umbrella. So this is going to be a thread that will run through every plan, every operation, every consideration from now on. So the data, again, the depiction of severe weather events, what MDAT likes to call natural disasters. And you can see I've broken this down from 1900 all the way through 2020 in terms of the type of natural event causing a disaster. So hydrological, meteorological, and climatological obviously being of primary concern in terms of climate change research. Extraterrestrial, I had to look it up just to be sure. That is like meteors, things from outer space hitting us. So it wasn't like little green men coming down. I was like, wow, we have data on that. That's cool. Nothing about Roswell, I'm sorry to say. So it's very, very clear to see that the sheer frequency of significant severe worldwide weather events is on the rise. But unfortunately, it's not quite enough. You have to go one layer deeper because it could be, okay, well, are we just having more frequent events that are less disastrous? And unfortunately, that is not the case. So you can see here depicted, this is kind of a 2-way chart depicting as before kind of the frequency of the actual events. And then in adjusted US dollars, we see the cost. And unfortunately, this is just within US dollars. This doesn't quantify the cost in human life, the cost in other resources, the cost in literal energy, homes, things that matter to people who are actually being affected. If you zoom in specifically on one meteorological event, hurricanes are a very interesting case study to look into, which we have in this research. Again, just the raw number of hurricanes, you can see I've highlighted there on the left. In the last several decades, a significant increase in the number of hurricanes. But perhaps more concerning, you can see on the right-hand side what I've highlighted. This is what the EPA calls the ACE index, for anyone who's familiar with this term. It's really an index that's an accumulation of intensity and strength and duration of a hurricane. So this is a good measure of the energy that comes with each particular hurricane event. And you can see those again in the last several decades have been on the rise. And then, of course, our EPA teammates have done a remarkable job at just kind of the money slide, right? So they've done a wonderful job at looking at this power dissipation index of hurricanes, which is very similar to the ACE index, and correlating, you can see that dotted line is average surface sea temperature. So again, it's very, very clear to see that the effects of climate change are very clearly affecting global weather patterns in very significant ways. So again, I apologize for our international teammates in the room. This particular slide is very US focused, but I think we all kind of get the point. I think all major governmental humanitarian teams are facing exactly the same thing. So this is an indication of US military foreign assistance events from our teammates at USAID. And you can see, again, since from 1947 all the way up until current day, very significant responses. And then again, when you quantify that in terms of US foreign aid assistance, in terms of billions of dollars adjusted, again, significant increases across the board. So really, again, all of the things that we already deal with as a humanitarian group of teammates are really just amplified as a result of global climate change. There's a really great, again, visualization. This is from our teammates at the UK Met Office, so please extend my thanks to them when you see them next. They've done a really great job at using data verifiably and objectively quantifying food and water insecurity as a result of climate change. So I apologize that this particular graphic is a little bit more subjective. It's a little bit squishy. You can see the vulnerability from low to high. So, how exactly one defines low or high. They do that in the paper. We just won't get into it here. But you can see, as of today, they assess key vulnerabilities primarily in portions of Africa, Saharan Africa, a little bit in terms of Eastern Asia, Southeast Asia, and South America. Now, global climate change left unchecked, using very little resources to adjust the carbon emissions. They're using their projection models. We're looking at 2050. Again, significant increases, particularly in Sahara and Sub-Saharan Africa and India. And then moving on into the 2080s, their projections indicate a vast majority of the African continent, portions of South and Central America, and a good portion of Southeast Asia on the borderline of uninhabitable in terms of not sustainable of their populations. So, right, and this is a real upper of a presentation, so thank you for bearing with me. Talking about climate refugees, I think, if nothing else, it's very indicative that we have that term is now in our lexicon as a humanitarian community. Both this World Bank groundswell report, I highly recommend you take that out, take a look at that. We're looking at, they're estimating about 200 million climate-driven migrants over the next 30 years, about 150 million being internally displaced with another 50 million international. The Institute for Economics and Peace have a sort of looser understanding of what they consider a climate refugee. They add in conflict, weather, sea level vulnerability, and they're estimating approximately 1 billion. So regardless of which set of numbers, those obviously drive a lot of concern for us as a humanitarian community. And again, the U.S. Climate Action Office is very, very focused on this, as well as a really great report. I'll have to speed it up here a little bit, but I highly recommend you look at this climate and conflict piece. They've quantified a degree increase, a degree Celsius increase in global average air temperature with a propensity or a likelihood for conflict. And they've actually quantified it. So we're looking at about 1 degree increase in global average temperature, equates to about 2.4% increase in interpersonal conflict, and about 11.3% increase in the likelihood of intergroup conflict. So when we're considering left unchecked, we're looking at climate change temperature increases anywhere from 4 to 5 degrees over the next 100 years. Obviously, this spells a very significant issue for conflict. And very quickly, secondary considerations as we transition, as we start to advocate more for green technology and renewable technology, where did those resources come from as well? And talking about how does that affect stability, how does that affect conflict? You can see here, these are nations that are responsible for a vast majority of the materials needed for lithium-ion batteries. As we look at how different nations are fuel-based, so some of the largest fossil fuel exporters, you can see are fairly large, fairly stable-ish nations, and some, Canada's up there. No, I'm just kidding. I love Canada. But, these are fairly large or stable, more stable countries. I'm sorry to the Canadian government if they're watching this. I'm not fired. This is the piece that concerns me a little bit more. The nations that have the highest percentage of their GDP, the nations who are most reliant on fossil fuels, are some areas of concern in terms of stability, in terms of propensity for conflict. So those are things that we as a defense industry and we as a humanitarian group really need to make sure we're focusing on if fossil fuel demand begins to decrease. So again, the secondary effects for us as a humanitarian world, we've already talked about this a little bit. We'll get more practice, unfortunately, at humanitarian responses, but as a lot of the other folks have said, with more events come the spreading of resources, financial and resources, and of course, COVID has made all of this exponentially worse. So our part, very quickly, really what it comes down to is being an advocate. There are a lot of things that we, of course, as an individual can accomplish, but really the biggest bang for your buck is going to be voting, is going to be being an advocate within your own institution and staying informed. The fact that you're all here, obviously you've gotten a pretty good portion of these. But what I would challenge you is to go back, take some of these tools to your team, your organization, and try and drive that change, because like I said, it will shape essentially all other operations. I can't help myself. This is a great tool. Please go check it out. This is from Climate Central. They call this an extreme scenario. They use scientific modeling. You can go anywhere in the world. And it shows, again, left unchecked, global sea rise. How does this affect you particularly or your organization? This is MacDill Air Force Base near Tampa. It's home of the 22nd Air Refueling Wing, a huge wing of our air refueling tankers, and home of U.S. Central Command and U.S. Special Operations Command, who have been slightly busy over the last 20 years. Left unchecked, over the next 100 years, we're looking at all of those installations as well as a majority of the greater Tampa area underwater. And you can run this little exercise for any area of interest. For our Navy teammates, go look up Norfolk and it'll, make you cringe a little bit. There are also a lot of really great local resources, so I encourage you within the US or when you go back to your own countries as well. There are a lot of resources. This is Rhode Island has built this tool. It's fantastic. You can literally go anywhere again and kind of look at, this uses a storm surge scenario, a 100-year storm. You can go anywhere and see if there was a 100-year storm today, what would it look like? And you can see this little nugget not far from here near the docks here in Providence will be about 13 feet underwater. So good stuff. Again, this is a really upper of a discussion. So with that, I will open it up again to questions and discussions. I think I've eaten up a good portion of the time, but I do welcome thoughts. Again, we will have a climate working group in the next 2 days as well, which I'll be co-leading, and I'm happy to engage in any of those discussions as well. So with that, I'll open it up and also leave my contact if anyone needs it. Thank you.
Fantastic. All right, so questions for Lieutenant Colonel Shanks.
Thank you, that was great. So I'm Ari Talani from the Center for Civilians in Conflict, or CIVIC, and I was curious if you could talk a little bit more about some of those scarcity-driven conflicts. So I know we've seen this pop up in a lot of different ways, herder-farmer conflict in the Middle Belt, resentment among communities in Iraq over water scarcity. I'm curious if you could do a little bit of forecasting for us in terms of like interstate competition or interstate conflict over water resources. Or resources in general. What are some things we could expect to see from some of those conflicts?
Yeah, well, I've never been very good at forecasting, and like any good military strategist, I'll throw out, well, it depends, right? But you're absolutely right. If given my understanding of strategic military planning and my research, especially over the last year, I would say there are very serious concerns. Really, one of the things that's kind of the bumper sticker phrase that we can use for the effects of climate change is everything that we have today, it will make worse, right? So places that we traditionally see occasional areas of drought will become significant areas of drought. Places where we see significant areas of flooding and heavy rainfall, we will generally see areas of extreme significant flooding and rainfall. You know, again, depending on the world's response to the effects of climate change and lowering our footprint of greenhouse gases and being able to mitigate especially the global average temperature increases. You know, again, I would say left unchecked, we're probably, I mean, you saw that, you know, the resource scarcity charts over the next 50 to 100 years, I would say we'll start to see significant increases in conflict specifically regarding those resources. So places where, you know, access to water or food insecurity are already, you know, vulnerable populations, we'll start to see significant more of that. So, you know, the hard part is again, it's going to be world events and global geopolitics is going to play a very large part in this. And unfortunately, the effects of climate change have a disproportionate effect on communities that are already extremely vulnerable. So, you know, and this is part of my sign call to the Department of Defense that, you know, even if the DoD went zero carbon today, it would barely move the needle in terms of the global effect of climate change. But what it can do is influence, you know, both industry, make things accessible to upscale technologies to make it possible. And frankly, you know, it's a responsibility of some of the, you know, the nations that do have these capabilities, that do have these resources to do what they can, not just to prevent future conflict and not have to get mired down in something in a different part of the world, but also from a humanitarian perspective, we can very easily save lives indirectly by some of these actions. So all of that is to say it's very difficult to tell, but places where you already see mild issues with security, we'll start to see severe issues. And of course.
Right here.
If you're from the Canadian government, I'm sorry. Okay.
No, I'm not. Don't worry. Thank you so much. My name is Basma Alush. I'm with the Norwegian Refugee Council. I wanted to kind of pick that kind of point or focus on the point you just mentioned about what can be done, especially reflecting on this incredibly daunting but brilliant presentation. And looking at the countries that you outlined that are increasingly dependent on fuel and those types of energy resources. If you can outline or kind of elaborate on what can actually be done to maybe wean some of those areas away from those types of resources, and what humanitarians can do to try to prevent conflict from erupting, kind of piggybacking on the previous question. Thank you.
So it's, you know, of course, you know, through my typical, you know, like American lens, it's very easy to consider domestically an analogy of, you know, weaning our nation from coal, right? And coal and fossil fuels. There are communities who rely on this as an income for their communities. And, you know, of course, it's important to say, okay, well, if there's communities who are going to be vulnerable, again, as a result of these changes, how do we make sure that we can build and stabilize those communities to meet those challenges? So whether it's talking about, you know, training folks who were working at the coal plant in terms of how to work sustainable energies, things like that. When it comes to on the international stage, it's so much more complicated, of course. Because now we're talking about, you know, is a local government willing to make those kinds of dedications? I can absolutely understand and empathize a nation that has this resource at their fingertips and to see its value start to slip away. And that's one of the things that scares me as a military planner is I could see a very significant effort and even up to the point potentially of military action of trying to protect that asset and its value. So I think really, and I know this is kind of a squishy answer, but honestly, I think this is where our international partnerships really come into play strongest. Because, you know, the United States or the Department of Defense can unilaterally move towards these green energies. But if we're not taking into account some of partner nations or even just other nations with whom we may not be partnered, and be able to bring them into that process, I think there's a significant diplomatic piece to this as well as like the technological and policy piece. So how we handle that as really a community is probably going to be the most significant factor in that. I will say, you know, the humanitarian world, I think, can also play a really significant part in this. Obviously, there are, you know, NGOs and non-governmental humanitarian organizations that have long-established relationships with governments and communities, and you can start to see that maybe bearing fruit. But it's a very thorny, difficult question, but I do think diplomacy and partnering is probably going to play a big piece in that.
Question over here.
Hi, it's Sam from LSHTM from the presentation this morning. Related question, but maybe just posed in a slightly different way. Have you seen any good examples of what you would call a climate-conscious military globally outside of the sort of US context? And if so, what might those be and sort of lessons that can be drawn from that?
Yeah, you know, obviously a majority of my research has been very focused on the U.S. Department of Defense efforts. Throughout my research, though, I've seen some fantastic examples. I think the German government is a really great example. I know the U.K. Government also is very focused. I suspect that the German government, particularly in lieu of recent events, is also extremely interested in renewable energy at the moment. You know, and I do know for a fact that the German government is very seriously considering some very significant 180s in terms of their national policy, in terms of sustainable fuels. They're once again very seriously looking at resurging nuclear power, which of course has been a significant political hot topic in Germany for decades. So, you know, of course, there's nothing good that comes from, you know, a conflict in Ukraine or any other global issues. But I do think that conflicts like that do bring to light the vulnerability that fossil fuels introduce. So I would say, not to digress to the point, yes, I have seen several other governments, particularly within the EU, Canada, and the UK, that have made pretty interesting developments in terms of starting to electrify their equipment and their installations. And the U.S. Department of Defense, I like to say I'm a little frustrated, but overjoyed that when I began this research about 8 months ago, I had this whole list of recommendations I was going to send to the Department of Defense. And each month, you know, they actually do great things. And now I have to check them off of my list out of my research. So I like to say I end up doing more deleting on my thesis than I do actually writing these days. But that's all a good thing. So I can say the DoD has made significant strides over the last 8 months in terms of their efforts and, no kidding, operationalizing some of these technologies.
I have time for one more question. Anybody? All right, well, if not, then we'll go ahead and thank Lieutenant Colonel Shanks for his presentation. And we'll all get 3 more minutes for our coffee break. So we'll break now and be back here, though, at 2:45 sharp because we have 2 more excellent presentations for you.
Nice job. Great work.
All right, all right.
Yeah.
You ready for it?
I hope so.
All right.
I hope we don't get any hecklers or anything like that. But
You'll do great.
yeah, it should be fun.
Yeah. All right, everyone, please take your seats. We're going to get started again. All right. Welcome back, everyone, for our final two presentations of the Research Symposium. So I am very pleased to introduce our next speaker, who's going to be talking to us about trends in Russian foreign humanitarian assistance from 15 years of open source data. So I'm pleased to welcome to the stage our own Jonathan Robinson, who's a humanitarian operations specialist supporting the Naval War College's Humanitarian Response Program, and also has been an integral part of organizing this workshop along with Alexandria. Johnny is also a specialist in aid worker security, conflict analysis, and humanitarian access, and has spent nearly a decade working in the Middle East. He has previously worked with the Carter Center Syria Conflict Resolution Program, as well as the United Nations Department of Safety and Security in Syria. So without further ado, welcome to the stage.
Thanks, Adam. And yeah, I'm also a global fellow here at the Centre at Brown. And, you know, like a lot of you in the room, I'm going to start with a disclaimer. You know, this is very much my own view, and this is not the official government position, and it's based very much on open sources. So, and we'll talk about that throughout the presentation. And so, yeah, I got started with this project back in 2017. I was helping a humanitarian organization with their access strategy in Syria, and I was in Damascus. And I was at a hotel in Damascus, and in walked a Russian delegation from the Reconciliation Center for Conflicting Sides, and they were there discussing humanitarian issues. I wasn't part of that meeting, but it gave me a window into that kind of, oh, I wonder what else Russia is doing there. And then later in the day, I met with some humanitarian organizations, and they were telling me that they regularly got rung up by the Russian center there, asking them to deliver aid to different places, almost like a taxi delivery service. And so, again, that got me interested in what is Russia doing here on the humanitarian front. It's well known on the military side of things and the diplomatic, political side of things, but on that humanitarian side, what are they doing? And so that started this research project. And so I'll take you through some of the findings as well as how I got there with the methodology and the data that I'm using. And, you know, look forward to your comments and questions at the end. So in researching Russian humanitarian assistance, foreign humanitarian assistance, like I said, it's often overlooked compared to its development, military and political activity. I noticed that current knowledge is out of date. The US Library of Congress has a report back from 2011, and the EU's last publication was in 2016 that I could find. When speaking to my humanitarian colleagues on the ground, there was very much a lack of knowledge within the humanitarian sector about Russian humanitarian activities and that impact on them. And certainly, I think that it's going to become an important era, if it hasn't already arrived, part of strategic competition, that competing sector. We've seen already Russia, with various cross-border resolutions and things like this, compete with US and other European humanitarian agencies. So, what did I use for my sources? So, like I said, very much open sources, English and Russian language sources. I looked at various official government documentation from Russia, so in particular their international development assistance concepts, which is in effect their policies. And one was from 2007, done by the Ministry of Finance, and then later on when the Ministry of Foreign Affairs took over that policy in 2014, and then various updates since then. Also, various public statements by key figures, Sergei Shoigu, Evgeny Primakov, also give a window into how Russia views humanitarian assistance. And then finally, a big portion of this study was the websites and social media reports of 40 Russian entities that I found in open sources who have delivered aid in 4 different contexts that I looked at in this study. So the Abkhazia, South Ossetia regions in Georgia, also eastern Ukraine, as well as Nagorno-Karabakh in the disputed area between Azerbaijan and Armenia. So I extrapolated the relevant information from this open sources. I read around 9,400 individual reports and managed to extrapolate just over 5,000 cases and reports of delivering aid to the ground, which could be geolocated, and also looked at what type of aid, if it was reported, and that kind of thing. And then in terms of being able to compare these different contexts, I categorized this data into 4 broad areas: the delivering entity, the location of delivery, the type of aid, as well as the date of delivery, so getting that timeline in place as well. And then visualized and analyzed this data, and you'll see this later on in the findings, and then check these findings with selected experts in my network. And so some caveats, very, very much before we start is, like I said, it's very much on open sources only. It's very much my own views. I've written previously in the Atlantic Council MENASource blog, so you can check out some articles there, particularly on Syria. I do know that there's a limitation of only using open sources, and particularly Russian sources. There's a strong bias. Unreported actions could be missed. But I do think it still provides a window, a snapshot into how Russia wants the world to view its efforts, and very much through its own eyes, through these Russian sources. The findings are also related to the 4 complex emergencies that I've mentioned, so not the natural disaster, environmental disaster response after typhoons or earthquakes or things like this. And also, please forgive any mistakes in terms of, how I've presented the data or naming conventions in maps. I'm not trying to imply, or I'm not trying to endorse a political context or point of view. It's just, purely for depiction purposes only. And so just to start, I think it's important just to kind of what do we mean by a humanitarian? And in the UN, USAID-led world, it's very much based around these humanitarian principles of humanity, neutrality, impartiality, and independence. These principles are very much an important mechanism to help ensure the safety of humanitarians as well as the recipient of aid. And when armed actors don't see a humanitarian group as impartial, this can have fatal consequences, as we've seen in Afghanistan and Iraq and Syria and other places. So it's really important to keep this in mind, and especially when we talk about military actors, US and other European nations, certainly can't be a humanitarian actor themselves because they go against particularly the independence principle of having political objectives, but they certainly strive to preserve that humanitarian space and principles. It's not perfect. I'm not saying they do it perfectly, but they certainly try. And it's important to keep this kind of viewpoint in mind when we start talking about Russia, because in short, Russia doesn't do this. And so we'll go forward there looking at that. And so, yeah, these are just some common definitions of humanitarian assistance. It's very much in the UN, US kind of world. It's focused on that life-saving activities, so saving lives, alleviating suffering. Other activities like development and peacekeeping and things like this are very much distinct, separate activities to humanitarian work. And so why do I say that? Because when we see Russia, Russia has very much a different view when it's talking about humanitarian assistance. So it's a much broader category, so away from the saving lives, alleviating suffering, and it's a much broader category that encompasses peacekeeping, humanitarian assistance as we would recognize it, disaster relief as we would recognize it, international development as we would recognize it, but also cultural diplomacy or public diplomacy, and that's using music, artistic, academic exchanges to promote a better image of a country. And so in that sense, it means that, putting on an academic exchange to talk about the humanities, if you will, is seen in the same way as delivering food aid to Syria. So there's a broader perspective there, if you can see what I mean. So that's certainly a starting point. In addition to that, when you start looking at the documentation about how Russia views humanitarian assistance, those foreign development assistance concepts, you start seeing kind of two themes come through very strongly in that. It's less about saving lives and alleviating suffering, as you can see in USAID policies and UN policies and things like this, and it's more about improving its image as a credible global power, especially through those public diplomacy activities, but also through its humanitarian assistance work as well. And then also bring some kind of economic benefit to the homeland, especially infrastructure projects, debt relief projects, construction, but then also using humanitarian aid as a vehicle to then allow some of these private companies to come in. We've seen examples in the Republic of Guinea in West Africa where Russia came in an Ebola response, and then the medics that were involved in that response were able to come in, a year later with their Ministry of Defense counterparts, and then were able to come in a year and a half later after that with private business counterparts. So really used it as a vehicle to gain access into the country. And then in 2016, a foreign policy update explicitly stated that foreign humanitarian assistance is an integral part of Russia's efforts to achieve foreign policy objectives, a soft power tool in its aid. And also when we see various Ministry of Defense articles, particularly at the colonel level, we see an interesting perception of foreign humanitarian aid, which is humanitarian aid is very much a tool of hybrid warfare. It's not neutral. It's seen as this almost quasi-military tool. And then in addition to that, we also see that Russia's perspective of humanitarians is very much rooted in the foreign humanitarians are foreign intelligence operatives. And so, yeah, there's a very different view there. But obviously, that idea of promoting a country or narrative through aid isn't different. The US does it, the UK does it, lots of different countries do this. But the way Russia does it is different. When we see, say, the US example, for example, we see a centralized foreign humanitarian assistance agency, USAID, direct those humanitarian efforts. That entity, distributes funds and support and aid through a variety of humanitarian actors on the ground, diluting that direct state influence. Those NGOs that receive that are accountable to boards and monitoring and evaluation processes and all of this kind of stuff, and other government requirements if they get funding elsewhere. This all dilutes that soft power and aid, if you will. Also, the US has signed up to the good humanitarian donorship principles. And so, it's not perfect, and obviously soft power is still present, but it goes some way in diluting that aid. And just as an example of that, we see this slide from USAID showing the different partners they support in Syria, showing that dilution, if you will. In Russia, it's a bit different. There isn't a centralized agency directing Russia's aid. Instead, there are numerous agencies that frame, fund, and facilitate Russia's foreign humanitarian assistance. When we look at data on the ground, we certainly see the Ministry of Defense and the Ministry of Emergency Situations, EMERCOM, which is a cross between FEMA and National Guard units that support kind of domestic disaster response. We also see the Ministry of Foreign Affairs and Ministry of Finance kind of help fund and frame its policies. And then also, interestingly, the Russian Orthodox Church also has a big influence there. And these entities directly deliver aid on the ground, and they don't distribute that funds, those aids on the ground. They very much do it, and they're the predominant entities that do this. When you do see seemingly Russian NGOs on the ground that perhaps receive some support from the government, there's around 23 secular and religious aligned NGOs that I managed to find who've delivered aid in the 4 different contexts. But when you start looking into these organizations, the separation from state starts kind of being a bit more blurred, if you will. And so, we start seeing in senior leaderships in many of these organizations are directly linked to the president's office or very pro-government, pro-Putin kind of entities. For example, the Combat Brotherhood Veterans Association, which delivers a lot of aid in Ukraine, eastern Ukraine. Its kind of very active deputy head is Dmitry Sablin, who is a member of the Russian Duma, a big pro-Kremlin entity and advisor to the president. And then when we see kind of the aid on the ground, at least half of those 23 entities that I found in my study exclusively rely on the Russian state to deliver aid on the ground. So they don't do it under their own steam. They need the Ministry of Defense or the Ministry of Emergency Situations to deliver that aid. And so in effect, I kind of call these NGOs quasi-autonomous NGOs, quangos, if you will, and they're effectively masked implementing partners of Russia for a lot of them. And so that kind of link, I argue, certainly reinforces that soft power between the state and its ability to exert its soft power on the ground. So very much more of a direct relationship rather than a diluted relationship with that soft power. And then when we see Russian coordination on the ground, this is taken from Syria. Humanitarian coordination is normally done by the UN Office for the Coordination of Humanitarian Affairs, UN OCHA. Very much, it's not perfect, but certainly is one of the more robust mechanisms to help organize humanitarian groups on the ground. Russia tends not to kind of plug in to that system at all. And so examples in Damascus, working in Damascus and focused on Damascus, they very rarely come to coordination meetings and keep very much separate, and so much so that some UN agencies I've kind of connected with have asked me for this data that I've collected on Syria because they have no relationship with what Russia is doing on the ground, and they're also based in Damascus. So I think highlighting that level of separation there, and so this all helps insulate Russia's humanitarian ecosystem, or what I'm calling a shadow aid system. It creates a separate aid system within the context. And you see this kind of system in Syria, in Ukraine, in Nagorno-Karabakh, and also in Abkhazia and South Ossetia. It doesn't integrate into the wider system. And so, getting down into the findings, we certainly see that in the first kind of key finding, I've got 5 key findings from this data, is that certainly context influences how Russia responds. And so when we see Ukraine and Abkhazia and South Ossetia and Georgia. That response is primarily, almost overwhelmingly, led by the Ministry of Emergency Situations, EMACOM, and that's Russia's internal domestic disaster response agency. However, when we look at Syria and Nagorno-Karabakh, a bit further afield, we see that it's the Ministry of Defense that overwhelmingly leads the response to these contexts. And this could be related to how Russia views these contexts with Ukraine and Abkhazia and South Ossetia. It's very much within its sphere of influence. It's seen as an internal context, and so that's why it's perhaps using its internal disaster management agency, whereas Syria and Nagorno-Karabakh certainly on that external viewpoint, and so that's a more expeditionary, if you will. And certainly, we see differences after food, water, and health, which is the predominant type of aid delivered in these contexts, or reportedly delivered in these contexts. After that, we see notable differences in different types of secondary aid, in particular reconstruction or construction type activity, as well as demining as well, particularly in those internal contexts. Also in Ukraine, it's notable that 44% of my data that I collected on Ukraine, you couldn't tell what it was. It was just classified as humanitarian aid in general. So, not so much transparency there. And this is almost ironic because one of the recent pushes by Russia with its cross-border resolution in Syria last year was to push the UN to be more transparent with its reporting in aid. So, certainly deflecting from its own shortcomings, perhaps. The second key finding that I saw was, Russian aid is largely very, shallow. It's if you look at the 842 places that have reported delivering aid in these four contexts, the vast majority, 98%, saw what you could see as limited support. 58% of those 842 places only saw single visits. Russia came in, dropped some aid, never to be seen again. And so that's a very shallow way of doing humanitarian aid. Anyone who's done humanitarian responses know that there's always that long-term view of how can we better a community, how can we help them in that long term. It seems that Russia doesn't do that. When we see the areas that do see sustained support, it's only around 2% of those locations that see over 20 visits in the past 15 years or so. And when we see that aid on the ground, it's rudimentary at best. These are some pictures that I got from some friends in Syria. And so you can see that their food aid is little more than plastic, shopping bags filled with a few basic supermarket goods. The 2 tins of tuna that was in that packet was expired, and so not great kind of support. And when we see the health kind of support, that third photo along, that's various kind of pharmaceutical items just laid out on a table, and folks were kind of told, yeah, take what you need, thanks very much, bye-bye. So not great kind of very rudimentary, and they certainly don't record any metrics on how aid is bettered a community or anything like this. Further visualizing that symbolic nature of aid, I put on these maps where different aid has been delivered, and so you can see, particularly in Syria, a lot of those smaller dots, they're those single visits, never to return again. And so you start seeing that the third key finding that I came across was a lot of the areas that saw those sustained aid deliveries were urban locations on key frontiers. And so we saw, for example, in Sukhumi, in Abkhazia, we also see Stepanakert and Lachin in Nagorno-Karabakh, Aleppo, Deir ez-Zor, Donetsk, and places like this, these concentrations of aid. They're all urban environments. And, I would argue that this has allowed Russia to gain experience in urban humanitarian operations, which are a specialized way of delivering aid. Okay, they don't do it so great, but it's certainly allowing them to specialize in these types of environments. And it certainly complements as well their military and political actions. And so a good example highlighting that is the Al-Salhiya district in Deir ez-Zor. And so that's just And so what we see there is that, according to Russia's own data, it only had 0.4 of Syria's population in 2019, and it's a tiny neighborhood. You know, it's only kind of tens of thousands of people rather than hundreds of thousands of people, but it saw over 10% of all of Syria's aid directed to this very small neighborhood, almost similar to, you know, the neighborhood that we're here in Providence. And, you know, yes, there were needs after it had been besieged for 3 years by ISIS, but it certainly seems like it was a good opportunity for Russia to showcase its soft power at the expense of the US, who were based on the other side of the river there of Deir ez-Zor. And it was interesting at the same time that the US and its allied forces were pushing down towards the last ISIS stronghold. Russia was setting up medical points and following it on the other side of the river, while the US were not doing that, and NGOs found it hard to access those areas until a few months later. So really showcasing that difference. And that focus on urban humanitarianism and frontiers influences Russian thinking at the higher level. You know, that cross-border change that we saw last year about kind of renewing cross-border activity, you know, Russia is very much promoting it wants to be delivered from within a context and across front line. And so, you know, where do we see that? We see that in, you know, aid being delivered to Damascus, and then across front lines like Abu Dhahor and Aleppo and places like this, which are those key frontiers. And so we're seeing that kind of play out at that higher level, perhaps. The fourth key finding is that it seems like from the reported data, Russia has a limited ability to mount more than one response at a time, one country response at a time. And so this timeline shows at the start of the Abkhazia, South Ossetia invasion, and we saw a big spike of aid there, and then it reduced, and then we saw as the first invasion of Ukraine started, we saw an uptick in aid, and then we saw a dropping off of aid when Syria started, and then another dropping off of aid as Nagorno-Karabakh started. So very much that limited. And in all cases, it shows that Russian aid can't be relied on because there's a general decline of aid, and particularly in Ukraine and Syria, that decline corresponded with an increase in humanitarian needs. So not responding to those needs there. Yeah, and then the final finding from this data is that state influence is growing in Russia's aid provision, especially in that young Kwango quasi-autonomous NGO sector. It's of the 83, there was around 83% of all aid in those four contexts that were delivered by state entities, and around 17% were delivered by those NGOs. And interestingly, most of those NGOs, 75% of those 23 NGOs that I found, they've all started since 2006. So very young humanitarian sector. You know, the timeline on the right there, it's in very small letters, I'm afraid. The green shows the top 20 humanitarian NGOs from the US versus in black the top 20 Russian NGOs that I found in this study. And the average establishment date of American NGOs is 1964. So, you know, it's a very young, inexperienced sector in Russia. So makes sense why they need to rely on the state there. And then, as I said, yeah, almost half those entities delivered with the state. And so that top kind of graph where all of those circles are show all the different links with joint missions done by different entities. And the big thick lines quite often point to state entities. So you can see the funnels of that support going to the Ministry of Defense, EMACOM, the Russian Orthodox Church, and others. And then finally, an interesting note with Ukraine between 2014 and 2021 is that initially there was a large state response at the start of, as you can see in that light blue color, but then over time it seemed like that NGO sector in that kind of sky blue kind of color took more and more of the response capacity in Ukraine. And so actually in Ukraine, you know, Russian NGOs made up 22% of all aid deliveries. So it shows that they can fill a gap in a response if they are able to. And it seems like the Russian government is allowing these NGOs to operate more freely in Ukraine. So to sum up, all those findings. It's very much, Russian aid has two models of aid response, it seems, that are both heavily influenced by the state, largely symbolic, and typically urban-focused. It seems to have limited capacity to mount more than one country response at a time, and also that the context influences the type of response Russia employs. And so I've called these two different responses, one a domestic-style response, if you will, that sees the use of the Ministry of Emergency Situations from within Russia to a context, so cross international border kind of thing, that is very much to a smaller number of those urban hubs. It seems to have more limited capacity. And we saw that applied to Georgia and Ukraine. Whereas there's more an expeditionary style response, as I've called it, that uses specialized Ministry of Defense centers from within a context, so Syria and Nagorno-Karabakh, to deliver to a wider set of urban nodes. So they seem to have a larger capacity there. But no matter what model is employed, Russia's aid is certainly kind of closed and self-sufficient from the wider ecosystem and complements Russia's military and political activities, especially if applied with disinformation. The picture on the left here is a poll done in Serbia from 2020, and Serbians were asked who gives Serbia the most foreign aid. And China, the EU, and Russia were named as the top three, when actually in reality it's overwhelmingly the EU. And so I think that highlights that misinformation, disinformation in that foreign aid space, combined with that misinformation, disinformation side of things. And I argue, all of this shows that Russia's aid system has the potential to rival, undermine, and devalue the wider ecosystem. And hopefully this study has provided an update to the views and capacities of Russian aid. And at the moment, I'm still trying to look at the future of the study. I certainly want to build a robust set of recommendations. I did have some recommendations in an article that's hopefully going to be published soon, and that will be on the website, my website that I have with the centre here. So do check that when in the next kind of couple of weeks, and that latest article will be there. But certainly I'm looking for a more robust set of recommendations. I also hope to strengthen the study by adding more qualitative research, interviews, workshops with experts, people who have perhaps received Russian aid, and getting that kind of more structured there. And then also comparing, I've got a larger data set that covers around 30 years and looks at also foreign disaster response by Russia, and looking to start comparing how they have responded in other complex emergencies, perhaps, so Yemen, Afghanistan, places like this, and particularly obviously where in Afghanistan, for example, where the US influence has waned, and how they're responding there, as well as how they respond to foreign disasters and how that has developed, as well as with other countries, say China, the US, the UK, the EU, things like this as well would be interesting to compare that. And then also, hopefully in this session as well, would welcome feedback, comments. It's not a perfect study. I definitely want to kind of keep improving it and keep getting useful conclusions out from it. And then I just thought I'd add almost an epilogue of current what's happening in Ukraine, because this study only goes up to November 2021. So, it stops a little bit short, obviously, with what we've seen currently in Ukraine. And it's unclear what model will be used in Ukraine, whether they'll continue that emergent, domestic style response with the emergency situations as they have before, or will they employ the Ministry of Defense more expeditionary style model? It's unclear whether they'll do that, whether they'll do a new model that has more of the NGO sector involved, the Russian NGO sector involved, or will it be different still? Will it be a Chechen-based model that they employed in the the early 2000s, which was to, in effect, restrict humanitarian access to punished populations there. So it's hard to know what they'll do, but certainly the increasing political isolation, as well as the sanctions and all of this kind of stuff, is only going to further isolate these Russian entities, as well as likely further increase state influence in Russia's humanitarian aid system. But with that, I will stop talking and open it up for questions. Thank you.
Thank you. All right, so questions for Johnny. We have one from Tom here first.
I don't know if I need the mic.
We do just for the live stream.
Yes, thank you, Seth. First of all, that was fascinating. Thank you for that. I had two quick questions for you, and my first one.
Do you mind introducing yourself first?
Oh yes, my name is Tom Cotter. I'm with Project Hope, INGO. Don't laugh in my face, but have you been tempted to reach out to the Russian government and ask for some data from them? I know you're using open source. My second question is, for a lot of the aid delivery, and indeed in one of your pictures showed military transport, what indications did you get of the collaboration between those NGOs or Kwangos, and thank you for that acronym, and the Russian military?
Yeah.
Thank you.
Great, yeah, thanks. Yeah, great question. I mean, certainly the data that I've used, particularly from the Ministry of Defense and EMACOM and some of the other Russian state entities, that comes from the Russian government. So there isn't, I don't think, a need to kind of reach out for that. But I would certainly, I would like to kind of get a wider sense of that, and certainly understand how Russia does that. So I'm always looking for that open source data. So, but I haven't had the confidence yet to reach out directly, given particularly my affiliation as well. But certainly it's something, there's always, data around. And so, yeah, that would be good. And then in terms of the collaboration, yeah, there's heavy collaboration there. Those military transports that you saw, very much that's how, literally NGOs will jump in the front of those trucks with those soldiers, drive to the delivery zone, jump out, and then say, yeah, we're giving you, folks aid. So there's a very strong collaboration with the military there. But yeah, hopefully that answers your two questions. Thanks.
Great. Over here, and then Joanne.
Hey, thank you again for this, really fascinating. But I'm Basma with NRC. So two quick questions, and maybe those are things that you're looking to explore in your next study. But just curious to know if you've had any conversations with aid actors about any efforts that are taken from their part to try to include Russian NGOs or the humanitarian actors, whatever you want to call them, to try to integrate them into the traditional coordination structures. Yeah. And then the other question is, have you had any conversations, or do you plan to have any conversations with the recipients of Russian aid and what those perceptions look like?
Yeah, no, thanks for that. In terms of aid actors' ability to try and bring Russian entities into those coordination meetings, I've certainly reached out to folks that I know in Damascus, and there's been a lot of efforts tried, but quite often it hasn't worked out. But certainly I think a window for particularly those NGOs, those Kwangos, is that, keeping in mind that many of these NGOs are people like us in this room who want to make a difference. The program managers, the people who are running those programs on the ground, they're trying to make a difference as well. They're inexperienced. Many of these NGOs started in 2006, and so certainly reaching out at that level I think could potentially be productive, and it's unclear in terms of how far that influence could go. Would they get a top-down kind of no, you can't do that? I don't know, but that level I think is certainly a good approach to start with. And then in terms of planning to interview recipients of aid, yes, I would love to do that. It's definitely it's one of my hopes for this project, and if people can help with that would be great. This project I've been doing very much in my spare time. It's not my full-time job. I do it in the weekends, in the evenings. evenings. And so certainly it's, my time is limited, shall we say, but I'm hoping to kind of dedicate more time to this. And yes, I would like to do that. Thanks.
Let's have Mark and Joanna both ask their question, and then we'll take those as the last two questions together.
Hi, thanks. I'm Mark Eric with CARE. Jonathan, awesome. Really enjoyed it. Echoing Tom's point as well about going to the Russians to get their take. What I'm interested, respectfully challenging you on something.
Great.
You talk about one of your takeaways has the potential to rival, undermine, devalue wider humanitarian ecosystems. I get undermine, I get devalue. Why rival? I don't understand what you mean there, because you kind of say it could be a counterpart. But in a way, what the argument is there's no real substance or value behind some of the actual work they're doing.
Yeah.
So why the term rival? Over.
And Joanna?
Okay, next.
Yeah, so I want to build on the question asked earlier about the collaboration between the humanitarian workers and the military, and whether you've seen any reports of their humanitarian workers being targeted because of that collaboration, and what their response to such targeting is if they don't use the same principles that we use, and obviously how that relates to their disinformation and kind of their information warfare that they conduct towards the West, if there's a relationship there that you've seen.
That's great, thank you. Yeah, no, thanks for two questions. I'll address Mark's first. I mean, in terms of rival, what I've seen is Russia's aid ecosystem. In effect, it's overconfident, and it has a larger presence, particularly in Syria, for example, than it does the wider ecosystem. So Russian Ministry of Defense has direct lines to the Syrian government. There are cases where the Ministry of Defense has in effect said this is what a perfect aid partner looks like. And so, in terms of that rivaling, they have very much an outsized voice particularly with the government of Syria, and that rivals the UN system, which is there. And so that's what I mean about rival. I think that kind of gets to perhaps the point of that, but happy again to keep, discussing this after these questions. And then in terms of targeting humanitarians, the only targeting I've seen is towards the Reconciliation Center in Syria, that MOD-linked entity. But I haven't seen kind of any changes of how humanitarians kind of operate. It seems like a lot of the humanitarians very much operate in relatively permissive environments, as it were, in Syria, so Latakia, Tartus, Damascus, and places like this. Whereas the ones who really link with the MOD, they'll be charging to communities close to the front line and very much using the Ministry of Defense as that protection measure rather than community acceptance, which a lot of the wider humanitarian community do. So, yeah, I don't know if that kind of answers kind of, yeah, but we can discuss maybe after this. But, yeah, thanks for your questions.
All right, well, thank you so much, Johnny.
Yeah,
thank you. All right, and then last but not least, we have our final presentation for the Research Symposium. The impact of stabilization initiatives in the Lake Chad Basin, the case of Northeast Nigeria. This research is really hot off the press. The data was just collected in January. We actually had a different talk that was going to be our fifth one of this research symposium for those who saw the earlier emails, and we decided to switch it based on this brand new data. And we're very excited to have presenting it Amit Arkapav-Goyal, who is a program lead at ELVA Community Engagement. He previously conducted research and analysis on the impact of emerging technologies in conflict, security, and defense. He holds a Master's of Science in Crisis and Security Management from Leiden University. We'll turn it over to him for the final presentation.
Thank you very much. Thank you for the opportunity to present. I think after the talks today, especially Jonathan's killer presentation just now, will be pretty hard to beat. But I hope nonetheless that my presentation in a more localized context will still be very interesting, and I think should fit in really well with the presentations this morning. I was telling Alexandria before, ours feels almost like a fourth case study. So I hope you share my view and find it interesting. My name's Amit. I'm a program lead with ELVA based in The Hague in the Netherlands, coming from there as well. We are a very small team. We are a Dutch NGO, but I think I will get to that once I just walk you through what I am talking about today. So first, I want to tell you about this project that we worked on. This is an applied research project. This is not an academic project. Really want to draw that distinction. I will tell you about the project, the objectives, how we carried it out. I will tell you a little bit of a context on stabilization response as a whole, because we found that to be very, very important given how unique the case of Northeast Nigeria has been. And then most importantly, to talk about the main component of the research, which was the impact that stabilization response in Northeast Nigeria has had on the local population there. So just going back to the organization, ELVA is a Dutch NGO. We specialize in primarily data collection and response. With respect to data collection, we refer to it as ground truthing. So really going out to the communities, talking to them, and getting quite a holistic perspective on how they view the dynamics in their own conflict-affected environments. We do this in the context of conflict prevention, conflict response, social cohesion, civil-military relations, and also preventing and countering violent extremism, because we primarily work in West and Central Africa, which are at this current moment an expanding area of insurgent presence. We work with a range of partners, but primarily over the last few years working with USAID, the Dutch Ministry of Foreign Affairs, and also UNDP. We're a small team, but we're quite well spread out. We also have colleagues in DC and in Abidjan in Ivory Coast, where we were all just there before quite recently. Moving on to this research, I really want to emphasize that this is a small-scale study. I would even refer to it as more of a scoping study and kind of attach all the disclaimers that Jonathan provided before about it not being definitive and really kind of just being a window into what is an incredibly complex and understudied topic, and hopefully that demonstrates the need for further research and discussions around it. This is research commissioned by the Norwegian Refugee Council, trying to also understand this complex issue, and I really just want to emphasize that the study is currently unpublished, so what I'm sharing with you is very much preliminary, but as Adam said, because the data collection is so recent, we thought it would be worth sharing. And also, what I'm sharing today does not represent the views of our NRC colleagues, as this was fully our work. The three main objectives were to understand the impact that stabilization has, to identify safeguards to current approaches of stabilization on return of essential services, impartial access to services, and assistance for conflict-affected populations, and to problematize the risks of causing harm through implementation of stabilization activities. Very briefly on the methodology, we used a mixed method approach, starting with a desk review of all the relevant literature. This was primarily strategies and sort of operations planning documents for the various organizations involved in the region. There were not many independent assessments of what has gone on in the region, given that a lot of it is also recent, so it is understandable, but compared, I think, to many other theaters, I would say that this is also quite an underreported region. And then this was complemented by our own primary data collection that was carried out by our partner, PSI in Nigeria, with whom we've worked in Nigeria for now many years, also up in Borno and Adamawa states. We did 41 key informant interviews and 6 focus group discussions across 6 local government areas, LGAs, 4 of them in Borno, 2 of them in Adamawa. And we tried to spread them out as much as we could, but of course there were also access limitations, and we were under quite some time constraints. So typically the communities interviewed were those based along main arterial roads, which of course adds some bias to the data. But as you can understand, it is a fairly challenging environment to operate within. And as such, of course, the research has its limitations, has its biases. We also were in touch with our ground team, who communicated to us that they think there may have been some self-censorship from the local communities, because when we do just one round of data collection, it's quite difficult to build trust with the communities if you're there for the first time. The way we found to really truly mitigate it is you have to be out there for multiple rounds over an extended period of time. There are projects on which we work for a year or two, doing up to 15, 18 rounds of data collection. It really gets you a better sense of the dynamics. But having said all that, I think it's interesting to talk about the content itself. I think I'm wary of talking about definitions at an academic setting. I know that's always a popular activity, but we found that defining stabilization and interpreting it was actually a key issue to its effective implementation and its impact in Northeast Nigeria. And so maybe because it's specific, there might be some people who are not fully aware with it. I just want to read out a few definitions to give you a sense of how different parties view stabilization. So according to the US Stabilization Assistance Review, stabilization is a political endeavor involving an integrated civil-military process to create conditions where locally legitimate authorities and systems can peaceably manage conflict and prevent resurgence in violence. It is transitional in nature, and stabilization may include efforts to establish civil security, provide access to dispute resolution, deliver basic services, and establish a foundation for the return of displaced people and long-term development. To bring it a little bit more into the Northeast Nigerian context, I would like to give you the definition of one of the strategies implemented there. This is the African Union and the Lake Chad Basin Commission regional strategy for the stabilization, recovery, and resilience of the Boko Haram affected areas of the Lake Chad Basin area, from here on after the RSS, which is essentially the document that underpins the regional response not only to the Boko Haram crisis in the northeast of Nigeria, but also Chad, Niger, and Cameroon. And the central objective of this regional strategy was generating policies and programs geared towards the short, medium, and long-term stabilization and development of the Lake Chad Basin region. And also, as TJ rightly pointed out, we should have some visuals. So just to demonstrate how all-encompassing this can be, the strategy has 9 pillars. This strategy was effective, I think, as of August 2018. 9 pillars with 40 strategic objectives. You can see that one of the pillars is humanitarian assistance. I think we will definitely dive a little bit deeper into that component. And specifically for the humanitarian assistance pillar, there were 4 objectives. One was humanitarian life-saving support, voluntary, safe, and dignified returns and resettlement, protection, and psychosocial support and social cohesion. So again, quite a range of functions there. While I only shared just 2 definitions, there are many, many more. We will include them in our report because we think it's important to show how different actors interpret it, especially different institutional actors. I think we can draw out a few key principles from what I've shared with you, and that is, first, stabilization is inherently a political objective. What we see in the context of Northeast Nigeria, it's about reestablishing the role of the government in an area where a non-state actor has contested their kind of political leadership for quite a number of years now. Second, it's a transitory approach, typically designed to have a civil and military component, with the military component used to degrade the initial violence to provide basic security, with the secondary approach of being kind of the more socioeconomic to actually restore basic services and bring a sense of normality into the communities. If from the case of the RSS, we can show that it often includes humanitarian assistance by design. And fourth, which I think I will also come back to later on, is that it does not always delineate the sequencing of these activities and where, for example, one element starts or where it ends and where another begins. And we find this to be actually a very critical issue in the context of the Northeast. Looking a little bit specifically at the Northeast context, just again for those, I'm sure most people here are familiar with the conflict in Northeast Nigeria, but just very briefly, in the 2000s, there was a rapid acceleration of the violence, which eventually generated a military response from the Nigerian government, a military that was typically prepared to fight symmetric conflict, not asymmetric warfare within its territories. And only by around 2014 did the military start shifting towards more of a counterinsurgency response and also looking at issues of preventing and countering violent extremism, so not just sort of a more hard security approach at counterterrorism. By 2021, just in Northeast Nigeria, there were over 300,000 refugees and around 2.9 million IDPs. Given how all-encompassing stabilization is, I think it's worth pointing out that with all the many strategic objectives included, there have been some reported successes of implementing such a strategy. When we spoke to expert interviews, they pointed to some successes of the DDR program, for example, localized achievements. But I think for the purpose of knowledge sharing and this presentation, I really want to focus on some of the risks and challenges that we identified, also in line with what has been requested. And also because we have heard from many partners in the region in West Africa that some of the response in Northeast Nigeria, particularly the implementation of the RSS, is also being used as a baseline by international actors to take lessons, to take approaches and implement them elsewhere, for example, in the Leptako-Gourma area in the Sahel. Looking towards what we identified as some of the key challenges to implementing stabilization in the Nigerian context, I think if you just look at a few of those, it should not be surprising. I'm sure most of you have worked in complex emergencies and would have seen this appear before. But just to, give it in all fairness, let's say, what we saw that the divergence of objectives occurred between many of the actors involved. But particularly one that we noted was the divergence of objectives between the national government and the humanitarian actors responding to the crisis. And that in essence there was an existential conflict whereby the government was aiming to restore the role of the state through their essentially political endeavor, and the humanitarian community, which sought to preserve neutrality and independence in the delivery of basic services and addressing the needs of the communities. What we see as a challenge, and this I really want to reflect on more as us as ELVA, the topics that we work on. My colleague who led this study used to formerly work in the Lake Chad Basin area with the US government, also involved with the DDR, actually leading the DDR activities from the US side in Niger. And in her experience in particular, but also in other settings that we worked on, we typically see non-state actors who have political ambitions feed on the government's inability to provide basic services to their communities. And so what we also see reflected in the Nigerian side, the kind of the frustrations that are echoed by the government, or the kind of the statements that are being made, is that the failure to align with the government's approach plays into the narrative of the non-state R groups, because they, again, if humanitarian assistance is not in line with the general response, they use that as a leverage to say, well, the government's not providing for you, we can, let us take advantage of being in this area, for example. And so as a result of this rift, but only that's, I think, one of the elements of it, there is more to it than that, we see that there is a lack of capacity and also lack of will to cooperate, which then leads to some fairly weak coordination between key stakeholders that are involved in the response. And as I will also emphasize later in the conclusions, coordination between actors is absolutely critical to implementing something as complex as a stabilization response. If it's not coherent, it's not going to work. And that's something that's become evident. But what we also see is that the way things are being implemented is very important. I think in the previous presentations, there were a lot of questions and comments about the quality of the services being delivered. We saw this come through a lot in the fairly small sample size that we worked with. What we first saw is that the security forces were not always able to provide security to the areas where follow-on activities were meant to take place. And so then that already undermines the first component of your response. If you can't provide security, you're not stabilizing an area. And so there was often evidence of kind of mixed activities happening concurrently, whereby, the provision of services was just not effective in areas where you have persistent instability. But even when services did follow in areas that had been stabilized and basic security was returned, there was often an emphasis on very short-term service provision. This was reported by communities both on the government side, but also other actors who are providing assistance, that because also of the lack of the coordination, some communities didn't receive assistance, others were receiving duplicated assistance. And what also happened was the focus was on very basic services, and that issues like intercommunal dialogue and peace-building activities were not sequenced in time, whereas they were prominently playing out in communities that were suddenly growing because of all the people returning to them. and the communal tensions were playing up right away. So it's great that they had some of the basic services, but already that was undermining the overall strategy in the region. I have quite a few inflammatory quotes attached, and these are already kind of the more calm ones, but you can get a sense of how tense some of the stakeholders feel in the region, and particularly when it comes to cooperation. Stakeholders in the expert interviews had quite a few things to say about each other as well. Just very briefly, and in the spirit of what we do as ELVA, just to share with you a little bit of what we saw in primary data in communities responding to the situation in their region. Generally, what we saw is that most of our 41 respondents felt safer as a result of what communities understood as stabilization efforts. And what was interesting to us is that they also reported not only feeling safer from the presence of NSAGs, but also feeling safer from violence and criminality that was present in their communities long before. So they said that what the government stabilization response did is it marked a real change in how the government responded in terms of securing these communities and providing basic safety. We did witness some challenges with communities accessing aid, but this is quite a difficult point to draw conclusions from, because what we also saw is that communities were often not fully able to disentangle what is stabilization and what is humanitarian aid. And I think, I believe in one of the earlier presentations, there were also such challenges when all the actors are working together. But what we did see in our setting is that there was, at least in our research, no indication that this blurring of lines put humanitarian responders to the ground at further risk. And I say no evidence just to say that it doesn't mean it doesn't happen, but at least we couldn't point to it in our research. And then finally, while communities were generally pleased with the securing of their communities, I think this data point reflects largely what I was saying before about the fact that overall basic service provision did not always improve. And actually just under 50% said the government had become either less responsive to their needs, or the government's responsiveness has not really changed since stabilization efforts began. And sorry, just to clarify, stabilization efforts is circa 2015, 2017. So it's quite a prolonged amount of time, and particularly the communities that we've targeted, they've been receiving, let's say, stabilization support for a good 4 or 5 years already. Moving on to the most important part of the presentation, looking at the impact of stabilization. Again, just a reminder that this is mostly just a window into some of the risks we identified. We saw that a quite large proportion of our respondents were concerned with their safety for cooperating with the government stabilization response. You see a total of 32%. However, what is a very important caveat here is that the majority of those respondents were actually based in one LGA, in one of the LGAs in Adamawa, where there had recently been reported sightings of Boko Haram affiliated elements. And as a result, it is possible that this influenced the reporting within the communities. And again, there were no concrete examples provided of these risks by the communities that we surveyed. As I mentioned, reintegration, DDR, was sort of touted as one of the more successful elements of the stabilization response, so I will skip that in this slide and mostly focus on the returns component. This was universally branded by our expert interviews as the most controversial element happening in Northeast Nigeria at the moment. For context, the return of IDPs and refugees has been an important element of the current Borno State governor's agenda. It was one of his, election ambitions back in 2019. And since the summer of 2020, they started effectively implementing it with over 140,000 IDPs moved out of camps. What we have here is under different pretenses. According to the government, these are fully voluntary returns. A lot of the partners in the response community do not share this view, some arguing that it goes as far as forced returns. What has also been reported is that humanitarians are often not able to operate in the areas where camps are being closed, as to push people to move away from the areas in and around the camps. And where this typically, the movement is still ongoing, but what has been identified is that often people are kind of pressured to move to locations that have been designated safe by the government. And again, this goes back to the point that I mentioned, where basic services to stabilize communities are not being provided. So what you often see is you have communities that are swelling in population. So one location that's brought up a lot is the town of Banki in the very east of Borno State, which grew from 40,000 people to about 65,000 in a very short amount of time, with no real change in service provision. So again, you can see how that undermines very much the strategy of what is being aimed for in the region. And I think lastly, as you can see here, there are still quite some challenges in people accessing basic services. It's a recurring theme throughout. I do apologize, I think the graph is a little bit messy. We still need to work on that. But generally, it's really a mixed bag. And I think this is what's also important, and why we say there's a need for further research is that there are quite major geographic differences depending on the level of security in a particular area. Just one final thing on this topic, because I know that it's been brought up a lot in the previous conversations, is the response of the different stakeholders, the non-governmental stakeholders in the region. What we see is that, particularly on the issue of returns, some are trying to avoid engaging in it because of the controversy surrounding it. Some cite the absence of a legal framework as an issue, whereas other actors quite certainly said they are continuing to work on the returns issue by advocating the government and by recognizing that there is still a need to provide basic services for the population. I think I can leave it there and focus on the conclusion. So what we have found again is that by including stabilization, including humanitarian response within stabilization, that presents an obvious challenge. But it is also clear that those who are navigating this, the African Union, Lake Chad Basin Commission, Nigerian government, they recognize that humanitarian assistance is a core part of bringing stability back into an area, and how to reconcile the two is essentially the biggest challenge at the moment, especially since the Nigerian government has kicked their response into high gear and have been putting pressure on their partners to essentially align with them on that response. We are very humble in determining how to navigate this and how to improve this response. So I'd like to emphasize that for now our recommendations are still in their fine-tuning process, and I actually very much welcome your contributions from experiences in other settings on how some of these challenges can be better addressed. But to start off with, what we're saying is that there's a need to really people to come together and redefine what it is that they're working towards, and particularly operationally. So talking about definitions, implementation of those definitions, end states, because often we see even if there are similar end states, organizations are working towards them in a different way and also not really communicating that with each other. And obviously, and this also connects to the coordination component, before that can restart, what is very clear in our data collection is that there is again a need to rebuild trust and goodwill between partners. There has been an erosion of that, and there's no point just saying that everybody needs to sit down at a table again and suddenly start working out strategies, because, well, communication has to some extent been limited between parties. One of the other ways to mitigate this is we think there's a real need to bridge the gap between intentions and outcomes. And one way to do this is to continue building an evidence base about the response, building on top of research like ours, doing it more holistically, more extensively, really getting into the details of what is going wrong and where the breakdowns are taking place, but also focusing on how the response is impacting the drivers of conflict, because clearly that is not being addressed enough. And the services that are being provided in areas of return, in areas that have been stabilized, are not sufficient to prevent the resurgence of violence down the line. And then finally, and this is something very particular to the stabilization response, but I'm sure it can also be applied to other settings, is that there's a need to sequence and segment approaches properly, to practically recognize that it's transitory and to figure out at what step, for example, can development assistance or recovery assistance be phased in while humanitarian assistance is phased out. And at least the impression that we got from the conversations we had with the partners is that this has not always been very clearly delineated, and particularly has not been done in a geographic manner, because throughout Borno, Adamawa, and Yobe states, the security situations are very, very different. They're very dynamic, and that we feel is not always reflected in the response. So thank you very much for your attention. I'll leave my email on here for any comments, any questions you'd like to follow up with afterwards, and otherwise very much welcome to your questions and contributions. Thank you.
Wonderful. So we got a fair amount of time, and we'll take questions from the audience. Well, while you guys are thinking of those questions, I'll start with one for you. I'm curious, in terms of your research, did you differentiate between different types of stabilization activities in terms of community perceptions, or were they sort of phrased just as one bucket?
Does this work?
I think it should be. It's
Is it on?
automatic,
Yeah?
right?
Okay. So the reason I also started with defining stabilization in this setting is that it was even difficult to define in professional kind of expert circles, and we found it to be even more challenging to define in the setting of trying to explain it to communities, because as I think again it was mentioned earlier today, they don't perceive the same ways that the response community perceives things, and to them they didn't quite see the difference. They could clearly tell the difference between provision of basic services and security. They know that when a military, a police, or a CJTF truck drives through their community, they understand that that's not humanitarian assistance. But on the wider provision of services, in our questions, we didn't break it down just because it was one round of data collection, and the questions were already quite overwhelming. So I think that's definitely also a limitation of the research that we were aware of going into it, but it's unfortunately just something that we had to go with, yeah.
Other questions? Got one over here.
Hi. In your recommendation, you were saying that there is a possibly a need to establish a same or shared definition, right? I was just wondering how the power dynamics within the community and other stakeholders will impact that goal.
I think that's the hardest question in the setting of Northeast Nigeria. I think what our research unearthed is that the power dynamics are definitely imbalanced, as I'm sure they are in many response settings. I will be very honest in saying that I'm not sure how you address it at this time. I think looking in particular at the presentation on the Syria-Jordan case, I was seeing quite a few parallels with that, in that there is unfortunately only so much you can do. I think particularly in the sort of West African context, the question of the state's role plays up quite influentially, and I think what from the other countries that we worked in the region, you can see that also in this state, in the context of Borno state government, the Nigerian government was a lot more proactive in dictating what sort of response they want to see, as opposed to some of the neighboring countries that are also afflicted by a similar problem. So what you found is that partners, both humanitarian but also international organizations, were operating in a much more permissive environment. And so here, in this setting, the government chose to exercise a stricter policy. They kind of had their own vision of how things would operate. And essentially that put them in the driving seat, with a lot of the organizations choosing to work together with them. UNDP very clearly works together with the Nigerian government on the implementation of these strategies. There's a number of other actors who are doing it too. So in that sense, it doesn't only create, I think, an asymmetry, but also just kind of the effect of numbers. I think it's very clear that, there is an imbalance of who is willing to get on board and who is not, to put it in kind of very open-ended terms.
Any other questions? Oh, we have one here from Mark.
Thank you. Amit, great presentation. Thank you. Not a criticism, but I'm asking you, and you stated you were collecting data along some of the main highways, or that's where some of the responses came from. Do you think, and then you were talking about a lot of the time, 50 plus, we're talking about stabilization being a good thing, or, you know, they were benefiting the communities. Do you think if some of the samples of data had come from some of the villages or, you know, away from the main highways, do you think you would have the same responses? And I do understand the practicalities and logistics of traveling across the Lake Chad Basin. Your bum is just sore by going up and down sandbanks. But I mean, but realistically, do you think those communities would still feel as safe if they're 300-400 clicks away from the main highways, where perhaps there is more of a military component or a safety and security command and control? Over.
Yeah, no, that's a perfect question. I can already see some others in the audience nodding, and they agree with that point clearly, and I do too. And I think for this presentation, I use some of the visuals just to kind of illustrate a point, but of course in our report we contextualize it much more. And I would honestly say in this case, more so than others, the expert interviews were critical because there is so much that is not reflected in sort of our small sample of data, but also in the formal publications that you find on the topic, and namely some of the strategies adopted by the Nigerian government where they recognized that they couldn't provide security across the whole of the state of Borno. As you said, it's a huge territory. So prioritization has been made towards certain geographies, but what that also reflected is that the Nigerian government has taken quite a strict approach into what can and cannot be done outside of areas that they've deemed safe, which are mainly those communities along the arterial roads, which puts communities in many other parts of the state, particularly in Borno, into a precarious position. So again, I think had we expanded data collection, I think we would have seen quite an extensive difference in responses, but I think that would also depend in which parts of Borno you would do it, because again, the situation does change quite a lot and has changed a lot over the last few years.
Great. Any other questions? Oh, one here.
Sorry, thanks. Rock Wong, Berg Forum. A number of European countries talk a lot about stabilization, but I'm wondering if that may not mask a less noble goal, which is to prevent large numbers of immigrants crossing over into Europe, and which leads them then to pay money to carry out policies that might prevent longer-term stabilization. Do you have any thoughts on that?
I think that just as with any other response to an emergency in a setting where there are political interests, you will see the kind of the conflation. What we saw with stabilization, particularly with the US interpretation, is that there's quite an overlap between stabilization and counterinsurgency. And that again complicates the definition even further when you're talking about state actors. I would lump the UK more towards that category as well. But what you see is that over time, the UN has also formulated its own definition and its own response based on its experience in Mali, for example, and in other contexts. And in Northeast Nigeria, I think it would be difficult for me to say definitively to what extent it is at play, simply because there were just so many actors involved. The US and the UK are very active in the region. So is the UN, so is the African Union. And again, based on the research we carried out now, and reflecting on the question a colleague asked previously about the power dynamics, I couldn't honestly tell you where we think all of the, kind of the pushing comes from. But from our wider work in the region, I think we've seen the kind of policies you're referring to play out more in other countries than in Nigeria. I think the migration-related policies are more in effect in places like Niger, which are actually along the routes for migrant travel. And as far as I'm aware, Nigeria doesn't feature as heavily as some of the neighboring countries for these sorts of considerations. And I think what's also very interesting in the Nigerian setting, I think the role of the government is quite prominent, of the Nigerian government. And what actually shapes the response in the Northeast is also the domestic political agenda in Nigeria. Because Nigeria, unfortunately, is suffering quite a number of crises now, one which is rapidly expanding across the Northwest, also periodic expansion of violence in the Middle Belt. So what goes on in the other parts of the country I think to some extent at national level politics influences the level of commitment to the crisis in the Northeast.
Great.
I think everyone's ready for drinks.
All right. Well, then we'll thank you, Amit, for your wonderful presentation.
Yeah, thank you for the opportunity.
All right. Well, we are delighted today to have Michael Marks giving some final concluding thoughts for our research symposium. Michael is currently the Senior Humanitarian Military Advisor for UN World Food Program. Prior to this role, he worked at UN OCHA for over 15 years as Chief of Policy Plans and Training and as a Senior Civil Military Coordination Advisor. Before that, he spent more than 2 decades working with the U.S. government, including with the Office of Foreign Disaster Assistance at USAID. And prior to that, he was a U.S. Army officer with tours in Asia, Europe, and Africa. So quite a wide variety of viewpoints, and he'll be giving us his perspective as the conclusion for our research symposium. Directly after his remarks, we will all go out for our final bit of coffee and snacks. And then again, as I mentioned, at 5 o'clock, shuttles will go back to the Graduate Hotel. And we'll see everyone back here tomorrow morning for the start of our workshop at 8 o'clock. Thank you.
Thanks, Adam. And just want to say it is a real honor to be able to spend a few minutes talking with you at the end of just the first day of a really great week. Adam asked me to do about 2 hours multimedia with puppet show, and I said no. It's not fair. So I just want to take a couple minutes. And first, I'm not going to recap the research symposium. I would not do it justice. But so much has come out of this already that in my mind just so many things that we need to focus on, so many things that we need to move forward on, and I think we've got even a good start on that. But before I do that, I do want to thank Brown University, the Watson Center, CHRHS for hosting this yet again. For those of you who have been around since kind of the beginning of this event, you know that it's gone through a lot of evolution. The fact that we're all sitting in the same room is awesome. I think this is where we work as a community best. I think over the last few years, we've learned how to deal with COVID and distance, but being able to get back together, back face to face, and really work through some of these issues is really, really important. Also want to thank the Naval War College and especially the Humanitarian Response Program and all that they've done. This has been their baby for many, many years now, and so it's really them that we have to thank for being here. And I also want to thank our partners at OCHA for co-sponsoring this with everyone else. The fact that you're here, the fact that we are here in this just barely, not even post-COVID environment shows how important this subject is. And it's not just you here in this room sharing your brain power, your heart on this issue, but it's a continued growing of humanitarian military engagement across the world. And we've seen this for the past 20-some years. It kind of goes and it plateaus, and then we have another crisis. But I think that if you just look around at the different components of our community, of the fact that there are academics now looking at civil issues, where we did not have that 5, 10 years ago, is huge, and we have it in significant numbers. The number of humanitarian organizations, it used to be kind of OCHA out there as the lone sentinel working this, but the World Food Program, UNICEF, UNHCR, a lot of our NGO colleagues are now dedicating capacity to civil military coordination, and that is awesome. And we're really glad to see that. The militaries have been focused on this for a long time, so I mean they're not really getting more into it, but they are re-engaging, and I think that certainly what's going on in Ukraine right now is refocusing a lot of the efforts there. So there is a lot of importance in this community, but also on this event. It's one of the few events that I know of that brings together the breadth of our community. The humanitarians, the military, the government, donors, the academic community, and kind of puts us all in a position to be able to think great thoughts, at least for 2 or 3 days, and move forward, and that is a really, really good thing. The topics we heard today, the papers, really great bridge to the next couple of days where we're going to be talking about humanitarian response in conflict during an era of strategic competition, which is our workshop theme, which either shows that Adam and crew are really, really prescient, or that they have some kind of trilateral peace in the world, because we're certainly in a high level of strategic competition right now and what's going on in Ukraine. So I think it's really timely that we get to go and look at that and try to move forward with some of these really complicated and very complex issues and concepts that we have to deal with. One thing I would like to see is if we somehow bridge the efforts we're doing here with the website dialoguing.org, which is the community of practice for the Humanitarian Civil Military Coordination. We have a lot of partners that have already posted on there. It'd be great if some of these papers or all of these papers could be found there, so that we have everything that we need at our hands, because it's really about the evidence base that's really important on this. Because for those of you who don't know, there have been a lot of efforts to kind of move the existing guidelines, with the Oslo guidelines, MCDA guidelines, which are really out of context, but still have great principles and concepts, and move them into where we sit right now in the world crises. Adam referenced the paper, Recommended Practices for Essential Humanitarian Civil Military Coordination of Foreign Military Assets in Natural and Man-Made Disasters. I was the stuckey to try to move that process forward. And the reason that we couldn't, and the reason it has the name it does, is because we had one very vocal humanitarian organization that pushed back and said, wait a second, you don't have evidence-based information. You don't have this already done by independent academic research, so you can't call them standards. Because the original title of that document was Standards for Civil Military Coordination, which is far simpler than Recommended Practices, which I have to look up every time that I reference it. So a lot of great thoughts already today. Humanitarian access in great power conflict, that is certainly something that is timely, something we're wrestling with in an operational sense right now. Johnny Robinson's work on how the Russians look at humanitarian assistance, we're struggling with that, even in terminology. Humanitarian corridors are not humanitarian, okay? And we're wrapping ourselves around concepts that we don't fully understand. So this work is really helping, not just from an academic sense, but also from an operational sense. So thanks for that. And that's why we're here, really, is make sure that what we do here translates on the ground operationally. Some of the other areas that we probably need to look at is some of the roles of other armed actors beyond just non-state armed groups and foreign military entities. We're dealing a lot with assertive states, and we talked about that today, certainly already with Nigeria. There's other states like Ethiopia, Haiti, Russia, that are having an impact on humanitarian assistance, don't necessarily agree with how we define humanitarian assistance. And so looking at how we engage with those actors as we move forward. Certainly gangs, if you look at the Haiti situation, is something that's causing us problems. Private security companies, whether that's in Central African Republic or Ukraine or other places. International brigades or non-national fighters. how we engage with those. And I think that we're going to have a really, really good test case here in Ukraine as we move forward with that. But that's not new. It's been going on, whether it's Chechnya or Yemen or Syria or other locations as well. So what we need to do, I think everybody knows. Really looking forward to the next couple of days of discussion and conversation and how we link all of these together. We want to make sure we do these in the best way possible, that we have the most effective responses as we move forward, and that we look at those secondary and tertiary effects, because that's really where we have the issues. Rob mentioned it a few times today about a principled approach and how we do that. We have to make sure that we're balancing that principled approach, not trading short-term wins for long-term losses. And really making sure that we do things in the best way possible. So I will stop there because I know that I am the one preventing you from coffee and from whatever else, beers probably. But thank you very much. Really looking forward to the rest of the week. Really thank you for the research symposium today. It was awesome, as it always is, and really a good way to kind of kickstart this workshop. So thanks, everyone.